Present.
Councilmember Wright.
Here.
Thank you, Dee. We have a few announcements tonight. First of all, a lot of people have been asking when can we go to phase 2. So Art Swanik from the Whitman County Commissioners released a statement yesterday to the mayors and council members to say the Whitman County Board of Health and Whitman County Commissioners have scheduled special meetings at 1:30 and at 1:45 tomorrow. That's May 13th, to consider the application package for the variance and a vote on it. Once approved by both the local Board of Health and the County Commissioners, our Public Health Director will submit the plan the same day to the Washington State Department of Health. The expected wait time, he says, is about 3 days for submission to DOH to make their determination. If Whitman County has a COVID-19 case diagnosed before the afternoon of May 13th, we will not be able to submit that application. So we'll keep our fingers crossed that tomorrow everything goes as scheduled. I saw that Spokane County has been trying to move ahead too to get to phase 2, but that's the timetable. So we'll find out tomorrow if everything gets submitted. And Gary Jenkins, our Director of Emergency and City Police Chief, thank you so much for all the work you've put in on this as well. We really, really appreciate it. A couple of other quick announcements since the state.
Glenn, I got a question.
Pardon?
I have a question. You're cutting up a little bit there, but I want to get a little bit of a clarification on the application.
Okay.
Okay. The application is coming from the county?
Correct. County does that. Gary, you can answer those questions too if you'd like.
Okay. County commissioners and the Whitman County Health Director, is that correct?
The Board of Health, correct. And the Board of Health has to meet. They take a vote, and then the Whitman County Public Health Director will submit the application.
And then I'd just like some clarification that the mayor of Pullman, all of the Whitman County commissioners, the health department in Whitman County, and I'm assuming all the other mayors of the cities in Whitman County are behind this request.
As far as I know, we are. That we're the ones that are basically asking to go to phase 2. We've been asking for that for some time. Matter of fact, I even had that conversation with the governor. But okay. Whitman County commissioners are the ones that have to take the action. Gary, you've been working with the emergency management person, and the same thing, right? Okay.
Correct. Yes, we've offered any support they need from the city of Pullman, but it is a county application.
Okay, I just want to clarify that you're behind this, Glenn, and you've requested this, as you've stated last week, and everyone else that I know of, mayors, county commissioners, and health department are behind moving to phase 2 if they'll pass our application.
The Whitman County commissioners are the ones who take the vote. We have asked, 2 weeks ago, we had a conversation, but yes, I'm behind it.
Okay, thank you.
We're trying to get to phase 2. We've been trying to get to phase 2 for about a week or so. So we just want to make sure we get in and the right way.
So I'm just trying to clarify a few things so that people understand that there's not one person trying to do this, that it's a concerted effort from the entire county trying to get to phase 2.
Right. And 2 boards have to make the vote to submit the application. But we've been mentioning to the county for some time, let's get to phase 2 as quick as we can and do it the right way to make sure we're doing it the right way. So
thank you.
Okay. The other thing is that we also have on our city website, just want to make sure that you know, at pullmanwa.gov, you can click on the red banner COVID-19 for any alerts and updates, any quick links. And we have a lot of great information from our economics development person. That person also has been putting all kinds of different grant applications out there. Jennifer Hackman has been doing a great job on that. Also, Pullman businesses and others can check the Pullman Chamber of Commerce website at pullmanchamber.com. They also include updates, and they send out updates twice a day. So with that, we now move to our special presentations tonight. Our first presentation will be from the CEO of Pullman Regional Hospital, Scott Adams, and we have one of our members tonight at the hospital checking out to make sure everything is going right there. And that's Adam Lincoln, who's been there for the last couple of days. I asked him if it was all right for me to mention that tonight, but he's getting very good care there and making sure that your bottom line is taken care of, at least for one patient. So Scott, the floor is yours. And again, I see Scott Adams there, which needs to unmute. There we go.
Okay, so now can you hear me?
And now we can hear you.
Wonderful, thank you. I appreciate the invitation from the City Council, Honorable Mayor and City Council members. Thank you very much. I did get an email from Adam this afternoon, wishing he could be with us tonight, but realizing that he's got another day or two of recovery before he can go home. So we continue to wish him well. I don't know if somebody can help me. This isn't a software program I'm familiar with. I was hoping to use a few slides to help me give you an update on our COVID-19 activities. So I don't know if Mike can help me know how I do that, or if I just have to talk and you listen and there won't be any slides to prompt me along.
Sure, Scott. I've made you co-host, so if you go to the bottom of the deal, you can share your screen. There'll be a box down below where all the pictures are.
Yeah, I had to use the browser version. It wasn't putting me in, and I don't see anything down there.
That's the end of my IT expertise on Zoom. I'll let one of the IT people jump in.
So while we're waiting for that, let me just share with you, we've had kind of two phases that we're working in. They tend to intersect, but are back in the middle of March, as most of the rest of the community was responding to COVID-19 concerns and activities on the west side. We at the hospital and the medical community were doing the same thing. We organized for our response. We organized a pandemic management coordinating center, and we had practices from the entire community as well as the hospital. We involved WSU Cougar Health and the SEL clinic to help us understand how to best respond to the challenges of the COVID-19 pandemic as a community of healthcare providers. So we moved into our surge preparations and how we maintained a healthy environment for the community when they sought healthcare services in physician offices or at the hospital. And that, of course, included social distancing activities and appropriate masking. Most of you will remember that it's been 2 months ago, but there was a lot of fluidity around those activities. And what we knew on one day would change pretty dramatically within a day or two. And so there was some pretty high anxiety among staff and physicians, but we persevered, I guess you could say, through those early challenges. We developed our surge plan relative to our capacity for our patients, our ventilator capacity, our PPE capacity, as well as our staffing capabilities to manage a surge. We also have been and continue to be active participants in the READY service, an Eastern Washington disaster management activity of all Eastern Washington communities to help coordinate surge activities on a regional basis. And that's been very effective. We get several times a day updates on the availability of ICU beds throughout the region, so that if there was a serious surge in any one community, there would be surrounding resources that could be drawn upon to help address that surge need and orient patients in the best place for their care. As we went through hypothetical situations, we talked about the possibility that maybe COVID patients that were in Whitman County, either in Colfax or in Pullman, might best be served by being transferred up to Spokane, where they had a larger number of these folks and more experience with that care. And we would then relieve a Spokane hospital of some of their less complicated patients here in the Whitman County Hospital. So there's been a good regional effort to understand our resources at the broader level and coordinate those effectively. Our personal protective equipment has been stabilized. Some of the supply chain efforts are still a little bit slow, especially around testing supplies, but mask supplies, face shields, gowns. Gowns is still a little bit tenuous, but we've had some great community partners with Washington State University and Schweitzer Engineering Laboratories. The community at large has been a wonderful partner, donating over 5,000 respiratory etiquette masks for us. Face shields and 3D printing was done by the university and SEL for us. And then Washington State University and their School of Materials Engineering, they were very helpful in designing a isolation gown that we could use, and we put into production for a number of those items, so that added to our inventory. So we've been able to include in the county's application our statement of readiness for responding to a surge and maintaining appropriate levels of protective personal equipment, as well as capacity from a facility standpoint to respond to a surge. And that's part of the application that the county plans to submit tomorrow. And we submitted that with support for their application. So those kind of capture the response activities. We remain in that mode. We have not had a COVID positive inpatient at Pullman Regional Hospital since the pandemic was declared. But we have tested in the testing center at the hospital nearly 800 people. And we've got just over a 2% positive rate, almost a 98% negative rate, which is a great contributor to the variance application that the county is going to submit for consideration. So we remain in a readiness mode, and we keep an eye on our PPE. We have weekly updates on our PPE inventory, and that helps us manage our utilization as we now move to recovery. Recovery is what we've learned is not along the same phases as the governor has outlined in the Start Safe plan. Healthcare is kind of set off to the side, and it's got its own set of restrictions that are still in place. Those were done by proclamation back in March 19th to be exact, and they will expire on March 18th. But there have been a couple interpretive guidelines submitted since the original proclamation, trying to provide a sense of balance between fully restricting access to needed services by chronically ill patients or patients with serious debilitation in their health, and continuing to protect PPE and its availability to be responsive in the event of a surge. So we've been working with those. We've begun to see expansions in. We've always done emergent surgeries and urgent surgeries, but now we're moving into the realm of necessary surgery. We're not doing elective surgery yet. We hope that will be opened up for us when the proclamation expires next week and there's further clarification for us. But diagnostic testing continues to go on, whether it's in imaging, the laboratory, sleep studies. Therapies continue or are expanding again, physical therapy, occupational therapy, and those types of treatment activities that are helpful to people trying to recover from illness or injury. And so our recovery plans continue to develop. They're going to be in several phases, just because not everyone in the community is sure that they're ready to return to the hospital. The hospital may be one of the safer places in the community because of the amount of precautions that are being implemented and the testing that's available. We've gone through several iterations of testing that now gives us a pretty good complement. We started off with our regular reference laboratory that called LabCorp, and they initially had about a 5-day turnaround time. They were able to narrow that down to about 3. But a couple weeks ago, we were able to enter into a partnership with Insight Pathology out of Spokane, and they've actually created a test that now has about a 24 to 48-hour turnaround time. And then just this week, we introduced our own instrument that's available for a limited group of people, for emergency patients, inpatients, healthcare workers, and long-term care patients, but it has a 2-hour turnaround time. And so we've seen continued progression Our supply chain and testing is keeping up with demand at the present time, so we feel good about that. We can continue to test. And now we're working with WSU as they're getting approvals from the state and federal agencies to open up their vet hospital for human testing for the coronavirus, which will be a great benefit. I'm sure that as those conversations continue on, how that testing capability will factor into the university's decisions for starting fall classes will be really significant. And we're anxious to be a part of those conversations and know how we can support that and bring that element of our community back to full strength. So the final thing I wanted to share is we have reported on a pretty regular basis the financial challenges that the proclamation for the governor presented to us. Early on, when we saw restrictions on elective procedures and other types of procedures being as dramatic as they were, we projected that over the course of 5 to 6 weeks, we'd probably experience about a $10 million net revenue shortfall. So we've been planning for that. I'm sure many of you remember the cost reductions we put in place over a month ago. We're now in the middle of those, and hopefully in about 4 weeks, we'll be concluded with those cost reductions, and they're on target to meet our goal. We have applied to 22 different funding sources that have been presented by the federal government. We've only qualified for about 20% of them. About 80% or more, we just don't qualify for. We're either not a not-for-profit, a 501c3, or we're too large. Or what they're wanting to do is for tribal medicine or serving tribal populations, which we don't have a large enough population to qualify for those. So we have received over $5 million in aid from the federal government, which is great. And these are not loans; these are grants, so these won't be repayable. So the foundation has made available to us so far $1.1 million through their fundraising activities, and then we've got our cost reductions that we're estimating will bring another $1 million. So we're just about $2 million short of closing that $10 million initial projected gap. So we feel we're in a pretty positive place, and looking forward to continuing to expand our services and move into the recovery phase along with the rest of the community, and see us get back into the rhythm of what makes Pullman great and what makes our community an attractive place for people to live and raise their families. So let me stop there and see what questions I can answer from the group.
Scott, thank you so much for that update, and thank you so much for letting us know about the finances and where that's going too. And I know that just the COVID-19, you've raised over $600,000 from donations from the community, and that's just been fantastic. So I see Al Sorensen has a question.
I'm going to defer to Dan. He had his hand up first.
Okay.
Thank you, Scott, for that presentation. I was wondering, just have you heard, or are there any ongoing developments in terms of using antibody testing or other efforts to assess kind of the rate of asymptomatic carriers in our community or across Washington in general?
There's still a lot of interest being focused on the antibody testing. I'm not a clinician, so I'm not the best one to comment on it, but the interpretations I have from those who can evaluate it more accurately and effectively still leave a lot of apprehension about its validity. It seems to have a lot of variation in the results, a lot of potential false positives or negatives. So there's still some concern about how widespread you want to count on antibody testing in its current form. Everybody recognizes that as a key to understanding the nature of this disease and how we manage it effectively, but not sure it's reached a point where people are comfortable using it in a widespread way.
All right, thank you.
Al?
Okay. Hey, Scott, just a couple of things here. I want to just go through a little bit here. I know that the hospital, and you and I talked, sent out a solicitation letter for funds to help support the hospital at this time due to federal, state, and local restrictions that have been put on And I just wanted to confirm so that people understand in the general public that the city of Pullman added absolutely zero restrictions in the city of Pullman or on the hospital in regards to what's going on. It was all federal and state levels. Is that correct?
Yeah, Al, and as when you and I talked, I acknowledge that that was an error on our part, and we've corrected that since then. So thank you for bringing it to our attention. That was just an oversight, and you're right. There was nothing locally ever done, never even talked about that I'm aware of that would have put any restrictions on the hospital.
Okay, thank you. I just want our residents and the people around here to understand that the city didn't do anything extra on top of the state. I also want to clarify with you, we've had a number of 16 cases verified in Whitman County, but Pullman Regional Hospital has had zero admissions to the hospital with COVID-19. Is that correct?
That is correct.
Okay, and one other thing here, you do believe that the city of Pullman, Whitman County should be moving to phase 2, and that you're ready to go in your statement of readiness, that you do believe as a hospital and a board that we should be at phase 2.
Yes, we believe we're capable. That our interpretation of our data is that we're a low impact community, kind of a cold spot in the midst of hot spots in other parts of the state, and that it makes a lot of sense for us to move into phase 2.
Okay, so Whitman County here and Pullman is a cold spot, is what I heard you say. You cut up. So,
Right.
okay, thank you very much.
Okay, Nathan.
Okay.
Thank you, Mr. Mayor. Scott, thank you so much for the presentation. I'd like to ask 2 questions. The first is regarding mental health. Have there, and I know you can't share a lot regarding patients, have there been any cases that have come to you regarding mental health? I know it wouldn't be usual, but my concern has always been with the stay-at-home order, the increase in anxiety and depression and substance use and so on and so forth. That's the first question, and then I'll wait for your answer to ask the second.
Thank you, Nathan. We recognized early on that some of the same things you just mentioned, Nathan, would be concerns that we wanted to organize a way to address, even with the restrictions in face-to-face visits. And telemedicine has been helpful, but probably not sufficient to meet the potential need. So our mental health providers have organized themselves, and they're producing a series of podcasts that are intended to provide some guidance and support and encouragement for folks that may find themselves struggling during this time of isolation. And we have additionally made telemedicine a pretty standard way of interacting with folks who have challenges now. I have not been made aware that we've had a surge in any of that activity in any part of the community, but I know that our primary care providers, as well as our behavioral health and mental health providers, stand at the ready to be able to do that as those needs may increase over time.
Thank you so much, Scott. That's actually really wonderful news. I had no clue that you were doing the podcast. That's great. The second question is regarding, I've had several citizens let me know that they had originally come to the hospital with signs, and this was before when we had not many tests, signs of COVID-19, but were told to go home instead of go to the hospital. My concerns, I know we all want to move to phase 2, are the COVID-19 cases that might possibly be out there, but they weren't originally tested. And could you speak a little bit about that? I mean, I can't give names or anything regarding that, but do you have some idea regarding what I've heard?
I don't, Nathan. it doesn't surprise me that early on, in the midst of uncertainty with testing supplies and disruptions in the supply chain, that there probably would have been a higher level of caution exhibited, and early symptoms or minor symptoms of potential disease might have been recommended to self-quarantine for a period of time rather than testing, to preserve the testing supplies for more acutely ill evidence of the disease patients. So that doesn't surprise me that probably has occurred, but I don't have any way of being able to respond of how some of those cases might have actually ended up developing into a case of COVID. Certainly, if they'd had to be in the hospital, then we would have known about that, and we've not had any of those. So all of the patients with COVID that have been identified have all recovered at home in the county. So it appears that from that small sample, and it is only 16, as Al pointed out, that the gravity of the disease has probably been of such that recovery has been able to be managed in self-isolation at home and without the needs of acute intervention at the hospital.
Okay, so then they would now be asymptomatic, correct?
Externally, and that's where Dan's question about the antibody testing would be so valuable if we could find a test that people could develop confidence in. But you're right, yeah, now they'd be asymptomatic.
Okay, thank you, Scott.
And just a reminder too, Nathan, and Scott pointed this out, and Troy Hendrickson, our public health director, pointed out, we've had a number of influenza A cases during this time period too. We've had influenza A, and that's shown up a couple of times. So someone that could have had some symptoms could have been influenza A as opposed to COVID. So I just want to point that out as well. Scott?
Well, I know, but also Troy has explained in the past, at least I know with the Poverty Awareness Task Force, that even though we've had 16 cases that have been identified, the cases that haven't been tested that are the concerning ones that are now asymptomatic. So I'm just bringing that up. I understand the influenza A, but it's those cases that we don't know about.
Right, right. Scott, any concluding remarks?
No, thank you again. The city council and the city staff have been very supportive to us and many others in the community as we've worked through this. So we appreciate that support and encouragement. Grateful for the outpouring of support from the entire community for our staff and the physicians, and making sure we're ready to provide the best care possible. We appreciate it.
All right. Thank you very much, Scott, for appearing today. We really appreciate it too. We're going to move next to our Pullman Moscow Regional Airport and Tony Bean. A number of things have come up with the airport. Obviously, COVID-19's impacted air travel nationwide, worldwide, as a matter of fact. But we've had construction still going on, and we've had some other things that are positive going on as well in terms of grant money. So we asked Tony to give us a presentation tonight and fill us in. So Tony?
Mayor, Council, thanks. My computer's telling me my network bandwidth is low, so hopefully this goes okay and everybody can hear me.
I thought I fixed that, Eric. I thought I fixed that at the airport. What's the deal?
We can hear you, Tony. So far, so good.
Okay.
So, and I assume they gave you a co-host so you can get your PowerPoint on, or you should have a lot of people drawing on the airport right now. Come to think of it.
I don't have a PowerPoint presentation.
Okay, very good then.
Well, we just landed a plane, so we'll see. So I got to start with just kind of the traffic and what happened with that.
I think may have just lost him for a little bit. So
He's still on.
I'm going to try to call in, I think.
okay, why don't you just do the call in, You have the numbers there in front of you that for the invite should have a call-in number.
I do. I do. I do.
Okay.
I'll just call.
Okay. In the meantime, we have Alan Davis on. So let's go to Alan Davis and then we'll get Tony all set up here. So Alan,
Okay.
since you're doing the parks update, obviously impacted as well. So we'll just go to you, Alan.
Okay. Well, thank you very much. Since the March 22nd playground closure, staff has continued to check and restore caution tape as required and deal with the greater than normal garbage accumulation that we've had. Park maintenance personnel were curtailed and seasonal interviews suspended on March 26th. When staff returned to work on April 13th, we immediately took advantage of the lack of downtown traffic and pruned the Main Street and Grand Avenue street trees. We started our mowing operations at the cemeteries and have been making some modifications due to the lack of seasonal staff. We'll be doing some contour mowing, not mowing the banks of Military Hill, and without the fireworks in the Sunnyside Park, we'll do the same there. And because we don't have to get it down due to fire issues. So we've already made arrangements in our division to make sure that we're addressing the weeds and the taller grasses. And without the seasonal help that we have, we'll be doing a lot more chemical control to take care of weed eating and mowing areas. Staff that was not involved with mowing or poison hemlock or other weed control, we worked with the recreation staff to relocate the Pioneer and Senior Center. And some of our staff is still working on a rather extensive to-do list in that new facility and probably will so for a while, I think. The restroom closures allowed us to work on a number of water issues, including some irrigation valve repairs that we need to take care of at Lawson Gardens. We're working in the streetscapes now downtown. On the facilities side, we've adjusted work schedules to address requests from ERD, M&O, and the treatment plant to accommodate changes in the hours of their operations. Now that the Pioneer Center and the Senior Center move is completed, we've taken our staff and transferred them to the new facility. And with the reduced time commitments in the library, that's permitted us to do a lot of deep cleaning, painting, numerous deferred repairs in a number of buildings. And as the closure continues, we're going to use part of our part-time custodial personnel to help and supplement with the mowing operations. He actually came from the park side to begin with, so that'll work out great for us. And so as we move forward, continue to reach out and monitor other departments across state, see how they're coping with the conditions and what they're doing. And with that, I'd be happy to answer any questions.
Any questions of Alan? Okay, Alan, I think you got by. All right, thank you so
Okay,
much for
thank
being on here tonight. So, okay, and is Tony on back?
I am.
Okay, Tony, we'll turn it back to you.
Okay. Apologies.
And we're getting a little reverb. So you have a
If that
speaker
helps.
on someplace that you can
Yeah.
shut off?
Does that help?
Yes, it does. Thank you.
Okay, so let's do this. Bandwidth at the airport for public Wi-Fi is interesting. Anyway, so appreciate the time and the opportunity to update. There's, it's just similar to what Scott said with the hospital. There's a lot of things going on with the airport. We started the year, and I'll go through kind of the traffic, and then we'll talk about the Air Service Development Grant, the CARES Act, and how it affected the airport, and what we're doing about the line of credit, and then construction and what's going on with that. But January and February, we were doing really, really well, and even about halfway through March, and of course, COVID-19 hit. And then April's numbers, we did about 4.86% of what we typically did, what we did in April last year. So less than 5% of the traffic that we had last year came through this year. Actually, though, the national average is about 4.7, so we're trending a little ahead of that. So it is not atypical. It happened to every airport in the country. The airline is running one flight a day right now, and we're tagging the flight through Walla Walla. So plane leaves Seattle in the morning, leaves Pullman in the morning, lands in Walla Walla,
and then goes to Seattle, and then at 7:10 in the evening, plane leaves Seattle, goes to Walla Walla, lands in Pullman. The flight figures right now, we were averaging about 11 people a day, and now we're somewhere around 30, so it's coming back slowly. The airline itself, starting on the 11th, will mandate masks on the airplane. So when you come to check in, Alaska is going to make it mandatory that you have a mask. If you don't have a mask, they'll issue you one. The terminal is not, it's not mandatory in the terminal. It is highly encouraged for people to do that, but we've got a lot of very empty space in the terminal. So when somebody comes into a rental car in the middle of the day, the entire time I'm in here, or Sherry's in here, as we're alternating on and off, we don't see anybody unless they're coming in for a badge under an appointment, or it's somebody dropping off or picking them up with a car, and those are very, very, very minimal at this time as well. So having that happen, one of the things that, of course, with the airport, the way that the airport is operated, we operate extremely lean. Our annual budget for 2018, which was the fiscal year that FAA went with, that Congress mandated in the CARES Act, our operations budget for fiscal year 2018 was $812,084. That's what we operate the airport on. So any hit in revenues is big to the airport. So we looked at parking and looked at, how much do you cut? It's very difficult to make big cuts with those kind of funding constraints. And then Congress passed the CARES Act, and the airports in the CARES Act were taken care of in a different fashion than I've ever seen. One of the things that they did was they put together a provision of $10 billion, and they worried about airports operating and that airports being able to pay debt service when, the Atlantas and the LAXs of the world. Well, airport revenue bonds are the only bonding source that has never defaulted that I'm aware of. They're just one of the few bonding instruments that they've never had a default, and Congress wasn't interested in having one. So they issued grants, and every airport was eligible for these grants. They are not Airport Improvement Program grants. So it's not like an FAA grant that we typically get, where there are specific rules to certain things. These grants are coming from the general fund through the CARES Act. They are not coming from the AIP, the Airport Improvement Program Trust Fund. And the FAA awarded airports on an expedited basis as per the law. I did send a CARES Act presentation that the FAA gave, and you can go for all of the FAA stuff. You go to faa.gov/airports/cares_act, and you can find all of the information that I'll be talking about. But we can use the Airport CARES Act for any purpose which airport revenues may lawfully be used. They're considered airport revenues, so they fall under the airport revenue use policy, and there's a large amount of restrictions that go with that. And then they got divided into 4 groups. So group 1, they took care of the federal share for the $7 million that was granted from FAA this year. So $6 million for the runway completion and $1 million for terminal design. There is no match, it's 100%. So they amended everything to 100% instead of 91.88. And then they have a second group for commercial service airports, which we fall into, was at least $7.4 billion. And then group 3, primary commercial service airports, which we also are, was another $2 billion. So 50% out of the group 2 was based on how many people got on a plane. So that's $7.4 billion. And then they broke down that other parts of it, 25% based on a percentage of debt service out of the whole. And then the last one is one that created a lot of confusion. And the last one is 25% was based on the sponsor's fiscal year 2018 ratio of unrestricted reserve to its respective debt service. And I'll kind of speak to what that talks about. If you have the availability to look at the presentation that I sent out, and if you go to slide 12 of that application, we would be Airport J. So we had in line 13, if you had a figure other than zero, and we had $88,000 in cash to end fiscal year 2018. And your debt service was zero, which ours is. Our debt is held by the partners. We don't have bond debt because we couldn't, with the revenues that we have, and nobody's going to bond us against our revenue. We simply don't have enough. So your ratio became 100% and they capped it in the allocation. Well, it boosted that pot of money. There were a number of airports that put zero in their unrestricted cash line. So if you had a ratio of zero to a debt service ratio of zero, your pot of money allocation out of that pot was zero. And there were a number of airports that happened to, that when they filled out their paperwork, for whatever reason, they put a zero in there. The FAA processed the formulas as per Congress, and we ended up with an allocation of $18,129,792 in CARES funds. But the FAA put a caveat on it. They capped it to 4 years of your operating expenses plus depreciation. Well, most of our depreciation was tied up in hello?
Yeah, we can still hear you, Tony.
Tony, you're still on.
Mayor, I believe he's gone now.
Yeah, I think we just lost a signal. Must have been when everybody got off the plane. I don't know how many people it could have been, but let's give him another second to call back in before we move on to Kirk Damon. Kirk is standing by, ready to go. So we'll let's give him about another 30 seconds to get called in. And if that doesn't work, we'll go to Kirk. Okay, Kurt, let's go to you and then we'll get Tony back. Okay.
Okay, thanks, Mayor. So just want to kind of give a quick overview of kind of where we're at, when this all started, where we're at today. So with the governor's first order, the stay at home went into effect there on March 13th, which led us to cancel all our programs through April 27th. And then with this next round on May 1st, kind of basically wiped out everything through May and probably into early June at this point. So when we first shut down the Pioneer Center, the Senior Center, the Aquatic Center, really a lot of our staff, we concentrated our efforts on packing up the Pioneer Center and Senior Center to get ready to move. So on April 13th, we did move the Pioneer Center. And as Alan mentioned, his staff provided a lot of the help and heavy lifting on that. And then on April 28th, we moved the Senior Center out of City Hall as well. And we're probably about 90% of things put away. The one big thing we're waiting on is the final inspection of our kitchen from the Whitman County Health Department. So in that first round of shutdowns after March 13th, just some of the things that were impacted were we canceled all our spring youth sports, which is soccer and volleyball, mini hoops basketball program, which impacted about 400 kids. We canceled, like I said, everything at the Pioneer Center, one of our bigger programs with a youth and adult dance program, which was 107 participants in that. All our fitness classes, reservations were canceled. Our preschool program, which was 64 families, that got canceled. And then with this last round of stay at home, ultimately wiped out that program through early June. And probably one of the bigger disappointments is that the preschool didn't get to have their graduation, which is kind of a big deal to see all those kids in their caps. We also canceled our 59th annual egg hunt, was part of that as well. So then on this last round of stay at home, really wiped out like our T-ball and coach pitch baseball, which is about 150 kids, girls softball, which is another 50, our co-ed softball, which is about 15 teams is what we average, is canceled. I mentioned last week, we are still looking at maybe trying to run some sort of cooperative program with Moscow Parks and Rec for some of our adult teams, which are really showing a lot of interest. Even if we had to start late June, early July, they still would like to play. So right now, as the recreation center, we are just kind of on hold, looking forward to when we can start. Mentioned the senior center when shut down, canceled all those programs, day trips. They had to cancel their annual Irish Feast, which is kind of one of the Senior Citizen Association's bigger fundraisers for the year. And then Council on Aging uses the senior center as a meal site on Tuesdays and Fridays. Obviously that got shut down. They are still continuing to cook meals out of Colfax and drop those there at the City Hall location for right now for pickups and deliveries. And that's by, I think they're still cooking about 110 to 115 meals a day. And a lot of those are, a small portion of those are in Pullman, and a lot are going out to the surrounding communities. But I think it's an area for Council on Aging that's really picked up in this whole situation. And then on Friday, we're actually, as we've kind of went to reduce staff starting Friday, we're actually going to use a transit employee that's going to do some deliveries for us that he's kind of been on some reduced work as well. Aquatic Center, we've been closed since spring break started, WSU spring break. So actually before the 13th with shut down, and then just never opened there. And that canceled all our swim lessons, which were probably 50 plus sessions this spring, our water exercise classes. And then the other part of that too is, we had 37 part-time employees at that time, many of those WSU students, who all lost their work. And kind of one of those factors as we look to reopen is what are we going to have for our staffing available to us? So a lot of those students went home. And so that's kind of a pinch point for us there. And also some of the uncertainty with staffing is a lot of their certificates is just, they look at expiring certifications. A lot of lifeguarding classes really take place in the winter months and spring leading up to summer. The Red Cross is working, extended some of those deadlines, but the other part is how do you recertify and do some rescues and training when you can't be, near somebody or working and touching somebody. So going forward for us is, really we've got to probably, or the state has to get to phase 3, where we can, look to do some outdoor activities with 5 to 50 people. And that's also when your recreation centers and pools, could open to 50% capacity. So for us, we're kind of targeting June 22nd as that start date for us. That gets us past, the school district will be officially out of school. It will also give us a chance to bring back some staffing, and then also work and implement, return to work policies and protocols that will probably be put in place. Our programming part of it, we'll have a different look for sure. We're not going to print a summer brochure to save costs, and then just this whole situation being so fluid. I think things are going to change even once we think something might be in place. There could be something that changes. So we want to be able to take things down and put other things back up quickly. So we're looking to put some sort of summer programming online probably into this month, with registration starting shortly after that, sometime in June. So we'll push information out through social media and the city website and our registration program as well. One of the things we're looking at is, once we do resume activities, what does that look like for us, especially in summer camps? I think what we'll probably look to do is definitely smaller ratios, somewhere probably to the 1 to 8, 1 to 9, versus our previous summer camps would be, say, 2 staff to 20 kids or 3 to 30, all kind of in one big group. And now probably looking at maybe still have 30 kids, but they're just going to be in 3 different classrooms and spread out through a facility if we can do that. And then also just looking at some of the recommendations from the CDC, the State Department of Health, as far as in those programs, social distancing, PPE, what are arrival and dismissal screening procedures if necessary with, families, and then cleaning, after camps and sanitation and, just all those things that, are going to be put in place. So, usually this time of year for staff is crazy for us, busy planning, getting things started, and we are on the exact opposite of that spectrum right now. But we're hopeful that we will be able to provide some sort of summer programming as we go forward. Any questions?
I just thought I'd mention, since you mentioned about the Easter egg hunt that we've done for years, Pete Dickinson, our city planner, has been like chair of the Kiwanis Easter egg hunt for I don't know how many years, Pete, but thank you again for all your service doing that. And then you mentioned also senior meals, and I see Eileen McCall there helping with senior meals all the time right at City Hall, where they're dishing those meals out and people are coming by and picking up those meals. So any questions of Kurt on this? And I know most of you would like to see that summer schedule going just as much as we would right now, with baseball and everything else going. So Brandon?
Yeah, Kurt, hey, I appreciate the update. This is not a baseball question, so for once you're off the hook on that. So staffing, let me ask about that. If we do summer camps, but we have to go into smaller groups, are we going to run into any kind of staffing issues that you may anticipate?
For our summer camps, I think the staff we've utilized for the last several years, I'd say 4 out of the 5 are still on board for us to do those kids camps, which are ages 3 to 5 and 6 to 11. So on that, I think what we do ourselves, I think we're going to be okay. And then we also do some contracting with like Skyhawks, and I know they're busy working with Megan Vining on what that looks like and the protocols they're putting into place as well.
Okay, and just one comment too. Pete, just because he's retiring does not get him off the hook for doing that Easter egg hunt through Kiwanis.
All right, Brandon, I'll be there.
Great service. Any other questions of Kurt?
Mr. Mayor?
Yes.
I just wanted to thank Kurt. He stepped up today and did the meal deliveries for the Senior Association or the Senior Council on Aging today. We had hiccup with some communications, and so Kurt jumped in his rig and delivered meals today for the program. It was an excellent effort on Kurt's part. Thank you so much.
That's why Rec has always done very well. He always steps in. He knows exactly what to do at all times. Right, Kurt?
That's right. It was something different, so I appreciated doing it. We got it covered though going forward Friday.
Okay. Any other questions of Kurt? If not, we're going back to Tony Bean. We got him back here online, and I'm hoping it wasn't Alaska that took him out of circulation there. So Tony, you might unmute, and I think you can go from there. Tony, one more time. I sent him a note and he said, okay. So I know he was ready to go, but
Hello?
Tony, you're there?
Can you hear?
Yes. Yep, you're
Yeah.
there.
Okay. So I don't know how far I got before I got cut off there, but.
Okay, you left off of the 18 million, the fact that we had no local match that we had to worry about. And
okay.
I think that's about where you were at.
Okay, so the $18 million come in 2 pieces, the way it worked for us. So this happened to 27 airports across the country where the FAA didn't write the formulas. Congress wrote the formulas. And so we ended up with, one of the things the FAA did was they looked at these little airports, and some of them are very small, and they're going, $18 million went to this airport. Can you even spend the money in 4 years? You have a period of performance for a grant. Can you spend it? Well, in our case, that answer is yes. We can spend that money because our capital improvement program for the FAA for 2021 next year is 11 million of FAA funds. We're going to start constructing a terminal over the next 2 years and have open probably in 23. So the concern right away became, okay, are you going to have the money and you're going to issue us 8 million and then you're going to hold the 9 million because you don't think we can spend it? And after looking at all the figures that we had, we of course can spend those funds. It's not a question of whether we're going to spend it or not. The terminal is going to take up all the funds. But I guess in my mind, the way that the funding works, that $18 million, our region put up $13 million internally to fund a runway because nobody else was going to fund it. And nobody else, trying to get a bond for that. Like you stated about revenue bonds, nobody's going to revenue bond an airport that doesn't generate, operations budget of over $1 million. It's not going to happen. So those funds essentially will augment or replace entirety of the partners' money that was already being collected towards finding out how we were going to locally fund the share of a terminal. And again, we'll go back to what kind of money they are. These are general fund monies. They are treated as airport revenue. They are not FAA grant monies, so the rules apply differently. They can't be taken out of the airport because they're airport revenue, but they can be used on what is known on the FAA side with FAA money as ineligible cost. So for example, talking about a terminal building, anything the airport generates revenue from, the FAA won't pay for. So office space that is rented to the airlines, office space that's rented to rental cars, parking lots, any kind of a concessionaire kind of a program such as a restaurant, those kinds of things, the FAA will not participate in those things. So typically eligible expenses for FAA Airport Improvement Program grants for a terminal are public space and that's it. Where the CARES funds really come into play is they can fill those holes where the FAA funds cannot. And then we looked at, can we go backwards with the funds? Could we, in a sense, could we go back and pay the sponsors' money back? We can't go backwards with the funds. CARES money can only be used for expenditures that we have going forward from January 20th, 2020. So it's an interesting grant, and I'm sure there are going to be questions on that. I'll finish my other pieces here, and then I'll take questions unless somebody's really got a burning one right now. I'll go through what's going to happen with the line of credit and how we're going to use the operational funds for CARES immediately. So our revenue is gone. We can't shut down. We're not allowed to. The FAA, that's not an option to the FAA. Once they open an airport, you stay open. And so one of the things that we had to look at is we can use it for operational expenditures. So we are using it for all of our operational expenditures. So we asked for the 8 million to be entirely operational, which pays operations expenditures, it pays match. So match for the runway right now, we're going to put those funds towards matching the runway immediately. And as we're drawing grants down so we can show movement on the grant, we need to get it drawn down quickly so they'll release the remaining amount of funds that we need for the terminal building. So we're going to be using that to replace the line of credit. And the line of credit, as we're closing grants, FAA's big metric is how fast you closing your grants. We just closed one today and turned in our final request for reimbursement for $821,500. And the line of credit will drop to $2,454,829. By the end of June, we will have 3 other grants closed and we'll be positive $53,409. There will be no line of credit. But the reason that we have the line of credit from the utility fund is because of how the FAA manages the grant. We get to 90% of a grant and the FAA hits the brakes. We continue paying but they don't pay. So they don't reimburse once it hits 90%, and that is it's like retainage. That's their incentive for us to close the grant, to finish the paperwork and make sure that it's done. Once we close the grant, they give the remaining 10%. So we end up holding that when you've got multiple grants like we do right now, that gets hard to manage. And Mike and Lori have done an outstanding job working with me to try to figure out how to get money back into the city as fast as possible. And the easiest way for us to do that is to put a lot of pressure on Mead and Hunt and close grants. But there's a lot that goes into closing a grant. It's very complicated. So those things are happening. We'll be off the line of credit, and then the CARES funds will essentially replace the line of credit. So the utility fund will be unencumbered from that point forward. As far as like air service development grant, it's coming. The good thing about the air service development grant is it's good till 2026. So we have till 2026. USDOT is quite well aware of the situation with airlines right now, and that could even be extended. We had outstanding airline meetings just before COVID-19 in March. The fact that we have 2 chambers that are as engaged in air service as they are, it's hugely important. So Marie's support, Brittany working really well with Jenny Ford on the Moscow side and going and pitching our communities and our region to airlines was really, really well received. United said they probably, at that time, before they really knew what the impacts of this were going to be, 2020, 2021, which still could happen, but it could go later, or they could even maybe move that up because we've got revenue guarantee funds. They know there's guaranteed revenue. You know, they could make a different decision and say, well, we need to move forward and start service, but we want them to start service when they're going to be successful. So that is of importance with the airline and the timing, but we have a lot of flexibility into that air service development grant to be able to go till 2026 and let the aviation industry find its new normal, because it's going to take a while. I think aviation is going to be the lagging indicator, because it's going to take, in my opinion, a lot for the public to feel comfortable getting on a full airplane. So I hope to see that happen, but I think it'll be, once we do see that happen, it'll be a very large indicator that people are comfortable with moving forward in a normal fashion prior to COVID-19. And in construction, we're full go. They're milling a runway up right now, the old runway, and they're building a large perimeter road so they can start moving earthwork, and we're going to start getting some massive bills that we're going to be matching with funds from the CARES as well as the FAA grant funds that we have. With that, are there specific questions regarding a whole bunch of information really fast?
Okay, I see Nathan. Nathan, we'll go to you first.
Thank you, Mr. Mayor. Tony, thanks. That's a lot of information to digest. Really appreciate it. I had a question regarding the airlines in the cabins of the planes. Are people being spread out? I know you said that there's less people flying, but are they being spread out in the cabin?
Yes. Yep. The airline is managing people and seats, and they're cleaning everything. And like I said, Alaska is mandating if you're in the aircraft, you'll have a mask. If you don't have one, they're going to issue one. But the cleaning regimen in the aircraft now is pretty draconian. And then there's HEPA filters inside the aircraft. I think it's every 2 minutes, the entire air system in the aircraft itself turns over. And then how they're doing it, when you've got 10 people getting on an aircraft, it's 76 seats, they can stagger them out, and even up to about half full. But we'll see what happens. Right now, it's just one flight a day, and I think they're gauging off of what they see for advanced bookings. And when they see enough advanced bookings to try to keep the social distancing protocols that they have in place, we'll start seeing additional aircraft.
Great. Thank you, Tony.
Any other questions, Tony? Dan? I know you unmuted. I saw that.
I have a secondary mute. You mentioned that some of this new funding from the CARES Act can't be used to reimburse sponsors for the previous pledges to that. Can any of that funding be used to augment kind of some of the secondary projects that are going on with the airport, like the extension of the sewer or other projects similar to that?
It has to be very specific to the airport alone. And that might be more of a Kelly Brown and Laura question than me. It's airport, the airport revenue use policy is a very stringent thing with the FAA. And so you have to be able to show it is, especially with utility payments. And I think that grant was very specific because the grant showed up today and it's got a very specific piece of language regarding utility runs. But if it was something that was going to be used for the airport and the airport alone, it was not going to get used by anything else. I think there's an argument can be made for that, but again, that would take legal minds that are sharper than mine.
Okay, thank you.
Any others? Nathan again?
Sorry, one other question. Are we seeking Blue Ribbon Advisory BRATC 0.09 money for the airport? I sit on the board. I was just asking. So we
are not. We have received, we received funds last year.
Okay.
They got us to 600. It's still left as a delta. The CARES Act has taken away the delta, so there's no longer money that is necessary for match to finalize the runway. We've got those funds in place. That was the first tranche that came with no match, so that helped with that, and it allows us to move the runway project into a finalization and really have the funds in place between the capital improvement program and the CARES funds to continue to stay on track with the terminal, because it's got the environmental piece on it, and it's the next pieces in our financial plan with FAA. We didn't move anything as far as projects, we just moved where the funding source was going to come from.
Okay, thank you, Tony.
Okay. With that, I don't see any other questions. Tony, thank you so much for your presentation tonight. We appreciate it.
Thank you, and I apologize for the technical difficulties. I'll do it from home next time.
I think he mentioned tonight, he said you didn't want to hear screaming kids. Otherwise he would have done it from home. So he was, okay, from now we go on to, we have two reports now from Mike Urban, our Administrative Services and Financial Director. First of all, the financial update, and then after that, we're going to hear about the economic conditions. So, Mike, we turn it over to you.
Thank you, Mayor. Good evening, Council. I'm going to share the first PowerPoint with you here. And can everybody see that okay? All right, so the first presentation tonight is going to be the quarterly financial update through 2020 Q1. My second one, we'll talk more about what's currently going on. So if there's a question or two that's certainly related to this and may have some other intention to the other one, let's make sure we get those answered. And the other stuff will wait for the second presentation. For those folks following at home, if you see some abbreviations on there, YOY, that just means year over year. So if you're following along. And if it pleases the council, I'll stop at the end of each slide like I did last time for all my presentations tonight and just see if there's any questions before moving on. I certainly can't see everybody at once, so I'm going to have you help me just jump in and go from there. So does that work for everybody today? Okay. Let's get up here and move to the next slide. There we go. Okay, so we're going to start in the general fund here. And just a note about the slides in general versus what you're going to see in the future. When I send out the budget information to staff, we're going to ask them to start budgeting on a quarter-by-quarter basis, so you can see how we're really trending to what the quarter budget was on everything instead of having to extrapolate this out for the year. So next year, these will look a little tighter, and then at the end of the year, of course, the fourth quarter will be the fourth quarter. But we look at the general fund revenue, $3.5 million in the first quarter for 2020 on a $23 million budget. And remember, when this budget was adopted, there was a $1.65 million shortfall between the revenue and the expenditures that we were going to use reserves to capture. Quick note on some of the future slides that I'm about to show here on the revenue. One of the things we watch very carefully, because I know this is important to the council, is the marijuana tax and the liquor tax. Because we're so early in the year and things are still very flat, I chose not to include those slides on this, but just for a heads up, the marijuana revenues for this year were $16,479 for the first quarter, compared to $16,662, so down about $150. Liquor tax was $69,359 versus same period last year of $68,755. So we're about $700 difference there. So we're trending very, very close to last year on those particular items. So before I move slides, are there any questions on this one? Okay. Sales tax revenue, our most volatile tax that there are. We talk about this a lot. So the 2020 budget was $5 million on this. We collected 1.268, very, very close to last year. We do expect the March numbers by the end of this month. I think April is a little bit more of the key indicator to look at, because that's when things really started to change. We didn't declare a state of emergency in the city until the 16th of March. A lot of activities kept going kind of up towards the 2/3 to the end of the month. So we're going to see a drop in March, certainly, but I think April is going to be really a key indicator for us. Are there any questions on the sales tax before I move on? Okay. That's not what you want to see. That's what you want to see. Property tax revenue. I sent out an email to everybody on Friday once we received the numbers from the treasurer's office. And
Hey, Mike.
where we are for the next quarter, we're still talking about first quarter here. So you'll notice quite a difference there. There was an outlier last year with collections on some past due properties that certainly made that go up. So first quarter trended very, very close. We'll talk about April here in a little bit, but I want to also take just a quick moment to thank Chris Nelson and Rayleigh up at the county treasurer's office. They've been just fantastic to work with and getting us data so we can work through this in a meaningful way. So thank you to them. Any questions on property tax revenue? Okay.
Hey, Mike.
Yes.
Hello.
Hi.
This is Al. I tried to catch you a couple slides ago. I just had a quick question in regards to the marijuana revenue.
Oh,
marijuana
yes.
sales revenue. You said it was about 16,000 in the first quarter.
Correct.
Okay. And I'm just gonna, from personal observation, it appears to me that the sales revenue on that might be going up in the next quarter. From kind of seeing what's going on out there. Do you have any projections on what you think that might do? And on top of that, are we really getting what we should be getting from the state?
The second question is really a key question now. That's something we've talked about in council meetings before, is the revenue sharing of that and the equity to the cities. And I know that's on our list of priorities. So because it's on our list of priorities, I'm going to just infer that I don't believe we're getting what we should be getting. And I believe there's a lot of folks that feel the same way about that. I can see where sales may be down a little bit with some of the population being gone, but those dispensaries look busy. I know that alcohol sales, if you read the news a lot, they're up everywhere. So I'm hoping some revenue from that, and as well as the profit sharing increases as well. So, that might be the light in the tunnel on this. Not that it's the healthiest light in the world. And on that, I'm going to take a pause.
Okay, thank you.
You're welcome. Okay, I want to be on building permit revenue. So this is kind of a look forward into the pipeline of what type of things are coming through planning and getting ready for building, so we can see what type of revenues may be coming in. There's some hangups with the stay home, stay healthy. The state said only new construction orders halted and other construction was being halted. So I don't know how much that backed up the pipeline. Due to economic factors, are we going to see this metric move at all? So something we'll want to keep a very close eye on too, because those building projects add to this property tax base, and it also brings in the sales tax on those one-time construction items. But 2020 is trending very close to 2018, down a fair amount, but we'll see as the days go on. It seems like we're still getting plans coming through the front door. Any questions?
And Mike?
Yes.
So this graph that we're looking at here is only for the first quarter of all these previous years also, is that correct?
That is correct. It's year over year comparison first quarter.
Okay, thank you.
Okay. Street and arterial streets, biggest change in year over year is attributable to the utility revenues going up and fuel tax going up. Certainly fuel is a lot less than as we've been going on here. I know at least in my house it is. I have some utility revenue concerns, which I'll bring up in the next presentation, but based on the first quarter, we did have some very solid collections for streets and arterial streets on those revenue items. Questions on this one? Okay. Transit revenues, again, it's trending very close to last year. Utility revenue has a hand in this particular item as well, but I just want to give council a heads up. We're going to see some negatives coming. WSU is asking for a refund on fees, and Pullman schools, since we weren't providing service for much of March and all of April and the rest of the school year, those are going to be revenues that we will not realize as well. So that is transit. Any questions on transit? Okay. Utility fund revenues, again, another healthy spike. The year-over-year change, timing of revenues from WSU when we got the check versus last year when we got the check. So it's still up without that, but that's kind of the real explosion on there is when you get to the end of the quarter, those couple days before the end and the couple days at the beginning, if something moves one way or the other, it could skew it. I mean, it'll make the first quarter look great, the second quarter look a little crummy, but you know, we have to have a cutoff point sometime and discuss these things. So any questions on utility? Okay. Civic improvement funds. This is the hotel motel tax. We turn the expense over to the chamber to run our tourism and promotions. So quarter one looked very like normal return. We were, you know, a little down in 19, but 2020 was very positive. Some of it maybe due to the clay game in January. So again, it just continues to work towards us. So we've collected about a third of that budget already in the first quarter.
Hey,
Questions
Mike.
on the, yep.
Yeah. Well, we just need to have more clay games. I think that would that would help.
They're fun.
Yeah. Hey, could I ask, because I know I have brought up the TPA before, and I know that there were some folks, some of my fellow council members wanted to know a little bit more about that. Would there be any way at a near future council meeting that you could do a brief overview of TPA and what would be required in that? Because again, I mean, I keep paying it with every other city, and we're not charging that here. And so I think it's a small amount, but it would definitely go into the civic improvement fund, and it's money we're leaving on the table, I think.
I'm writing myself a note to start working on that. And yes, I will bring that back to council for a presentation.
I have a question.
Yes,
I
Pat.
think Laura provided us with some information on that a few months ago, if I'm not mistaken, on TPA. And I don't know that we qualify, but I would defer that to Laura.
Yeah, Laura, I don't know if you want to weigh in here.
Sorry, second mute. I would have to look at it again, Pat. I don't recall what the reason was before, and I know I looked at both the TPA and the Transportation Benefit District, which the initiative impacted. But yeah, I will look at that with Mike, absolutely.
Sure.
Thank you.
Yeah. So I'll work with Laura, and we'll put some effort into this and try to get you something just as soon as we can stabilize in the finance department and with the things that we have going on. But I'll certainly keep on the research and keep you in the loop.
Thank you, Mike.
All right. Back to my civic improvement. Okay. Any other questions on civic improvement before I move on? Thank you. All right. General fund expenses. This is where everything turns to a different discussion. The money has quit coming in, and now it's going out. So again, the $2.4 million of expenditures was what we budgeted over revenues. So we have some makeup to do here. You see that very large spike of 1.6 million. A lot of that can be attributed to the CIP items for New City Hall. They're flowing through the general fund, so they hit our books properly. That's a large portion of this. We do have a consultant coming in to help with the comprehensive plan update. There was district court contract that increased. We had insurance increases, and certainly the bargain salaries. We had moved this in that direction. But really the big player in this were the CIP items. Any questions on general fund expenses? Okay, we're gonna break a few through these. The legislative fund, just looking at that, a small increase on that. Really, it's attributed to our increase in AWC dues and increased election costs. This is something I'm working with the county auditor to try to curb and curtail, so it can be a little bit more equitable to the citizens of Pullman. Any questions on this page? Okay. Finance, administration expenses, legal, everything falls under here. For the COGS, you'll notice that there is a huge increase on this. And again, it's attributable to, this is where the CIP stuff hit in this particular grouping. The first slide was all of it aggregated. This is the sub fund of that. So that's the biggest part of that. And again, the insurance increases fell in this group as well. So any questions on this before I move on? Okay, thank you. Okay, law enforcement expenses up slightly, change year over year. Again, bargain salaries, staffing increases, the district court payments fall into this fund as well. So really it's where we were expecting it for the first quarter pre-COVID. Any questions on law enforcement before I move on? Catch up on my notes here. Make sure I'm not missing anything. Okay, fire and ambulance, again, same as law enforcement. Really the difference are the staffing increases and the bargain salaries. So the increase fell within the parameters we were expecting pre-COVID on this, and it's kind of where things are at right now with the general fund. Any questions on fire before I move on? Okay. Community economic development. This is, planning, economic development, or protective inspections. We're lumping them in a group. Changing year over year, we created a new department with economic development, and glad to have Jen Hackman on with us. She is working really, really hard right now. And then the consulting contract for the comprehensive plan fell into this bucket as well. So that's why you see the change from the previous year on those items. Any questions here before I move on? Library expenses change year over year. It looks like a large spike, but if you do the dollar change, it's fairly close on that. There was a good sized non-CIP remodel project that fell under the $10,000 threshold. And then, staffing costs on that during the first quarter pushed it up just a little bit higher as well. Any questions on the library? Okay. Parks and Recreation, it trends right along normally until this year, and then you see that recurring theme of the CIP and other improvements. A lot of that has to go with new City Hall, and now that rec is in that building, I expect some trailing expenses going into April, but not many compared to the rest of the building, since that's still under construction.
Mike, can I ask, doesn't this, we now took over government buildings and parks too, doesn't that?
We're still treating government buildings as it's still an internal service fund, so I have that near the end, because we're still treating it as an enterprise fund. So even though it's being managed by parks and it's parks and facilities now, we are only looking at the general fund parks items in this.
Okay.
Okay, streets and arterial streets, slight increase, well, actually a fairly sizable increase looking at the dollar amount on there. Bargained salaries, CIP items, and other improvements moved that forward. A lot of the projects in 2019 got moved into 2020, and then when things started to change the beginning of March, we ratcheted back everything, but some of those really early projects, January and February, you're seeing realized here on this chart. Any questions on streets and arterial streets? Okay. Utilities. This is the one where it looks really good when you look at the chart, but there's kind of two pieces moving here because this includes the 401 utility funds and the 404 stormwater fund, as well as the 403 capital funds for projects. So on the first part, the utility expenditures are up quite higher than they were the last year, not huge spikes, but they're definitely trending up. But because we aren't getting to some of these utility projects and we were holding off on some spring work and summer work, that was significantly down. So it gives us kind of this false negative, but it does average out because this is the group that handles all of that. So we do aggregate these together. So as we go through the years and look at this chart going backwards and forwards, we'll remind everybody about what was happening at this particular time, as if anybody's going to forget 2020 at this point in the day. So questions here on the utilities expenses? Okay. Transit, again, another large spike, and it can all be explained by a large capital purchase that hit in the first quarter. So it's sitting there on our books, about $1.8 million. So you pull that out, really, we're just looking at some capital improvements and some salary changes there. So that's another false positive based on about every couple years. You can see back in 2016, it was $2.1 million. Then it goes back down to 850. So as we pick up some of these capital items, yes, we see this type of activity come through. Any questions on transit? We're almost there. Internal service funds, things like facilities, ERD, IT. They're aggregated here. We basically treat it like an internal utility where we're paying fees to these funds to keep them moving. You can see that the year-over-year change is increase in repair and maintenance because ERD is part of this, and they had put off a few purchases until from 19 into the first quarter of 20 through some of our budget amendments. So they're hitting that, and then there's also some new City Hall associated construction in this fund. So any questions on this one before I move to the, I believe, last slide? All right, here we go. Okay, so final thoughts, the economy in general. I never want to take this off my presentation, but we're going to be talking about it a lot here in the next one. I guess the economy best put is it's not what it used to be. The budget process for 21-22, we'll be ramping that up in the next 6 weeks and reaching out to departments. We're going to be asking them to hold the line on 2021 budget and treat it as if we're in it right now. So until we get an idea of what recovery looks like, we can budget conservatively, and as monies become available, we can deploy them on our hopes and our wants and what we'd like to do for our community, as opposed to just keeping the lights on. The CIP process, as council sees these quarterly items come in, they see the equation and how the money rolls into the CIP fund. For the benefit of those watching, very simply, it's a formula where we look at the end of a quarter and we subtract out of our sales tax dollars any construction sales tax dollars because it's too volatile to predict. And with those dollars left over, once we've reached a threshold of $595,000, we split those dollars that go into the general fund and go into CIP. With sales tax the way it is, I'm really concerned that we're going to be not able to put much into CIP this year at all. Still predicting a very strong fourth quarter, but we got to get through quarter two first to get there. That is all of my notes. So I thank you, council, for your patience. I miss doing these live, but I certainly would love to answer any questions you have on the first quarter before we jump into the next presentation.
Mike, I just have a general question regarding expenditures, and I know that this is something that always tends to come up where we're spending money, and usually there's a good explanation that it's coming from some budget or other budget, and maybe it doesn't affect something. But I know that a number of my colleagues have brought up what we're spending, and even seemingly things that I'm not gonna mess around with public safety, but repainting certain sidewalks or crosswalks. I know it happened in my neighborhood, and you could still see the sidewalk from before, so it looks great, but it was maybe one of those things that we could do without. You see the bills. I mean, you see where we're spending money. I know I've heard that we've been told to not be spending money, but it feels like there are certain areas where we're still spending money. So maybe you could touch upon what you're seeing, and if there's truly a way to curb some of this that is not dealing with City Hall.
Sure, you bet. I look at vouchers and sometimes pull my hair out, and not as much as I should be. I should be praising city staff too for, when this happened, they really jumped on board and started, pulling the reins back and jumping out there, canceling some contracts, canceling some back ordered items. So one of the items I have, and I'll go short in the next presentation on this because I was going to cover it a little bit too, but this is a perfect time for it, as we can talk about what I keep talking about is buckets. So you have the general fund, and that's, they have their revenues and their expenses. That's their bucket. The best way to discuss this is sales tax comes through the general fund and supports general fund items. Sales tax does not go into public works to do roads, and conversely, utility taxes designated for public works doesn't come back into the general fund to do that. So when a revenue is designated for a fund, that's the bucket it lives in. So revenue in, expenses out, and never the two shall cross. There's rules on that. There's accounting rules, there's RCW. There's ways to get it across. A good example on that, Councilman Chapman, is when the finance department performs the utility billing for the water utility. Although the dollars come through the water utility, we do an interfund transfer to cover the work done in the finance department to cover those expenses. So utility funds, utility revenues come into Fund 401. They're used for what they're needed for. And then the utility fund pays us, for lack of a better term, as a subcontractor to provide their work for them for billing. They will do an interfund transfer. Now we've realized those in the general fund. So when we're doing other work in other departments like streets and arterial streets, they have certain revenue sources that are designated for those activities. So when a sales tax hit happens like this, it doesn't really touch things in other funds per se, except for the interrelatedness of the funds. So when an example I kept giving is how are you looking at all these cutbacks but doing a roundabout? Well, the roundabout dollars are coming through those funds, and that's what it's for, unless we change everything around and reallocate these dollars. But that's how we have the different funds set up. I got a little in the weeds on that. Should I stop there, or
No, I appreciate that, and I think I understand the principle of having the different buckets and allocated for certain things. I just, there's also that optics. Yes, we did approve a roundabout, for example, and I know it was a situation where we're talking about budget, and at the time I felt like I made the right vote, and I also feel like Al and Eileen made the right vote, right, because they were concerned about budget. So what I'm worried about is if we're then spending $10,000 on street paint to do something. Meanwhile, we may have situations of furlough or other employee situations. That worries me. So I'm trying to reconcile that, because if there's no street paint to be put down, then I realize that those employees don't have something to do either. So I know there's a balancing act, and I'm just trying to figure out where if we're looking at budget, right, which is what we're supposed to be doing, what recourse do we have?
Right. And so we kind of look at what's the minimum viable product. And this is my MBA work coming out of me again, so a little bit from the private sector. But what do we need to provide as a city to our citizens to keep the basics running? How deep are we cutting? So you look at some things like painting streets. There's a certain public safety aspect to that. I don't know which neighborhoods looked better than others, but we certainly want to have middle lines painted and fog lines, of course, and this is the time of year to do that. So when we look at work from each of these departments, that is something that's being discussed at the administrative level and with those department heads, and I do watch those bills very carefully, and so does Councilmember Parks and Councilmember Records, who've been on my audit committee, and they've been asking very, very good questions. A lot of us why. So we've been working through some of that as we continue to curtail. So
thank you. I appreciate that.
Okay. All right. Any other questions before I switch presentations? Okay, Council, thank you. I will be back with the second quarter items when they're complete, and we'll keep doing regular updates as well. And with that, I'll go ahead and switch into my next item. Bear with me. I'm sharing screens again. This one is a lot less slides, but I think more discussion. Okay, hopefully everybody can see the City of Pullman effects on COVID for today. And all right. So the first thing I want to touch on are the grants that we're looking at, because these are some opportunities for some dollars to help us out in different places. And really right now we're looking at 3 different grant funding sources. So the CARES Act, there's some FEMA dollars out there, and there's the FTA, Federal Transit, that's going through the DOT. So we're going to touch on all of those. The important thing I want everybody to know on the outset is we're looking at these three very strategically and seeing what we can push into which bucket so we can maximize the return to the city of Pullman, because there are certain restrictions in each of them. And, if it doesn't work in one, it certainly has some opportunity for the other. So I've been working really hard with Wayne Thompson in transit and Chief Lamoureux in fire. Wayne's obviously running the transit one, and Chief Lamoureux is running the FEMA one. So we've been talking back and forth and getting a really good feel about what's going on. And we're working with staff too to make sure everything that can be identifiable and justified under any of these grants is properly accounted for, receipted, and we can get reimbursement. So going through the different grants as we see through here, the first is the CARES Act. We did finally get the number. I think I alluded to that during the last meeting, but $1,036,800. We have not received these dollars yet. They are on their way. So we wait with bated breath. Again, costs incurred for the rest of the year. We can't use it for revenue replacement, and we can't use it for items that are already in the city budget. So I have been working very creatively. I have had long discussions with the mayor and city administrator. I even went toe to toe with Laura on come on, this really should be justified. And she sent me back to the drawing board, and I'm going to work harder on that one. And at the end of the day, my accounting manager, Lori Palmer, is very up to date on the CARES Act. So when I think I have found something that qualifies, I have to run it by her and get her sign off before I can add it to my spreadsheet of things that we can use it for. So we're working very hard to make sure we can maximize every one of these dollars, and I will break some bone in my body to make sure that that happens. I won't leave you guys undeterred. The FEMA grant, again, that's something that Chief Lamoureux is doing. It is for costs starting January 20th. I know he had a meeting with his grant coordinator today. I haven't heard if there's a stop date yet. We did talk. It didn't come up in the conversation, but it just continues to go on, and it's at a 75% reimbursement rate for what we send in. It's $131,000, but we don't know if that's really capped or not at a higher number. We just know that $131,000 we can report on the EZ form, and then after that we have to start reporting in a different method. So if we can push more money into here, we're certainly going to do it, but we're really looking for some feedback from FEMA as to how far can we go, because we'll take it to the limit. There's fees that we could put into this that are sitting in the CARES grant right now. And if we don't have to use the CARES grant for it, and FEMA says, yeah, sure, bring them all, we're going to push it into here, because that just opens up more in the FEMA grant or in the CARES grant. So let's see. And just a quick note on the FEMA part of it, council was generous enough to allow staff to submit the SAFER grant for firefighter retention, and that was submitted today ahead of the deadline. So thank you for that opportunity. We'll hear back on that in September. Before I go to the next slide, are there any questions?
Yeah, Mike, you know me in words, it says funds for supplies, the last bullet here, to respond to the COVID-19 public health emergency. So, I mean, supplies to prevent, prepare for, but how broad is that definition for respond to the COVID-19? You say you're trying to be creative. I'm thinking, as we respond to something, does that mean those funds could be used for civic improvements, as in terms of community events, to raise morale, to make people get out and exercise and take care of themselves better? Or how much flexibility is that in that respond?
I love these conversations, Councilmember McCall, because I'm in the same boat. Those FEMA ones are really more directed towards the response, actual medical type response. Now, what you're discussing fits into the CARES Act.
Okay.
And so we're looking at that more in that activity. There's some items in there, but when it comes to the FEMA, it's a little bit more narrow tailored. How are we responding to this? You know, are we buying new equipment like the decon scrubber for the ambulances? That's a way to respond to the CARES deal, because we're taking care of our staff, making sure we can decontaminate the units and sterilize the best we can before we go on the next run. That would fall under that. But yeah, when we talk about the respond is also another word used up above. So yeah, we're looking at those types of things. What type of programs can we do? One of the programs that we can do for the CARES Act is healthy return to work. So we've tasked one of our staffers, Megan Vining, with when the city goes to reopen, what are our policies? What are our procedures? Where's the central PPE for the library and the finance department? Fire, police, in transit, they're doing that every day, but we need some help in the other departments too. So that's covered under the CARES Act, so we can make sure our staff is returning to a safe and healthy environment.
Because one of the things that I ran across, and I sent this on to Kevin, was I ran across some information about antimicrobial playground equipment.
Oh.
Which was, yeah. So get with Kevin on that one, but I can see where maybe that would fit into, could be shoehorned into this category.
Sure. I'll take a look. If you wouldn't mind forwarding that to me as well, I can start noodling it and put it by my inner critic or my outer critic at this point, could have her take me to the woodshed and make sure it fits.
All right.
All right. Okay, good. Any more questions on this one? Okay, we got one more grant to talk about really quick, and that's the FTA. This is the one I keep referring to as being the most broad and general and allows more than the other stuff did. So it comes through the feds, through state DOT. We're using the rural formula in case you hear something from somebody else like Seattle. There's two different games being played here. But we have 1.25 million, and the next line's really kind of key. We have costs going out for a couple years on this. So where there's opportunities to, once things stabilize, do some future planning for these types of things, there might be some money in the meantime. Of course, we're pushing as much as we can early on to help stabilize the operations for today. But if we run out of if we come back sooner than it looks like, and there's still money in the bank, we can parcel that out over the short period and get to a point where we use all this one up. So this one feels kind of good. Again, just operating expenses. The difference between this one as well as FEMA versus the CARES is we have to accrue the costs, send in for reimbursement, where CARES, we're just going to get a lump sum and we have to account for it and send anything back we don't use. So FEMA and WSDOT, there's a little bit of a cash flow to that, managing it, but for free money, we'll figure out a way to do that. So kind of the last little point on this is there's another round of grants on the horizon, but it's probably going to get bogged down a little bit at the federal level. But what we really need from the feds and the state is just a lot more flexibility to be able to use these dollars. We're getting all this stuff to respond to COVID, but we're not getting all the dollars we need to keep operations going at the level we originally budgeted for. And really to a point too, where the feds keep printing money, but we're not getting a lot of help from the state that ordered the shutdown here. And to the point where actually heard from our county emergency manager that the state's going to start billing the county for all the PPE at the beginning of this that the county was receiving, and then we were receiving for Pullman via the county. So we're expecting a bill for this. There's grant funds available, as you're saying, but we can't use those grant funds for other things. So I'm really hoping the state finds a gear and helps some of these municipalities out just on its own and not waiting for federal help. Okay. Any questions on this one before I move on to the next? All right. just some general economic factors. I know everybody's reading this in the paper, but it's worth the discussion. Unemployment rate, sure, it's, federally it's 14.7. We tend to fare a little bit better here in the Palouse, where the county's seen 2,200 new claims since the 20th. We should have a new update on that in the next 24 hours to see what the week over week claims were. Statewide, we're, just shy of 1 million people right now. So, if we do the workforce and the percentages, I think the state's trending fairly close to the 14, maybe on the south side a little bit, and the county's certainly trending below that even. So it's still not good, but we're not other states where it's trending worse. Washington has adopted the 4-phase approach, as everybody's more than aware of. Mayor already touched on the petition to phase 2, so I won't belabor that. Idaho being 8 miles away, when they're open, certainly I have concerns over sales tax bleed into that state, and hoping we could figure out a way to get to phase 2 so we could start spending this money here. Gross domestic product is really just kind of a placeholder for my next item, but as you would expect, it's going to drop in this quarter and it'll probably drag on a little bit. And it's important to know that when you look at gross domestic product, that even state and local governments contribute to that. Up to 8.5% of GDP is, comes through state and local governments. So because of that, the weak economy, it's going to kind of keep inflation down, which is nice considering how much money we're printing. So really, it's near-term inflation right now looks like it's going to be 0 or barely above that. Again, I'm worried about mid and long-term consequences of that. And if we do have a lot of inflation, what does that mean to us as a city, since we're tethered to that 1% property tax rate hike by I-747? And if inflation's going up, but we can't raise the taxes to keep up with it, where does that put us? So that's really something I'm looking at the horizon. It's a concern, but the immediate concern today is in stabilization. So any questions on this slide?
I got one, Mike.
Yes.
Just a comment here. You mentioned on bullet point 2, talking about the 4-phase approach, and then you brought up Idaho and the Idaho bleed. This is something that I brought up last week, and it's a real thing. And you're just confirming that today, that we really need Whitman County to at least mirror as much as we can what's happening in Latah County, so that bleed is as minimal as we can have it. I compared it to a small leak and then a flood, same type of thing. It's something that we really, really need to hopefully stay in touch with them, because, like I mentioned last week, cars, vehicles, people are still traveling to Moscow. They're still traveling to Pullman. That really hasn't changed. So hopefully the things that we're going to see with our applications starting tomorrow will be able to help us with that. Do you agree with that?
I do. And Eileen, I saw your hand go up, so I'll just answer real quick and then jump into you. But I have genuine concerns. I also have concerns as to what happens if we move to phase 2 and we have a case. Do we go backwards? Do we wait longer than the 3 weeks to move to phase 3? Do we have to go more weeks now without a case? I don't know what the playing field is from phase to phase. And I don't think it's been really published to my peer group very well, because we're all asking each other to say, hey, have you heard this? So yeah, when it comes down to that, genuine concern, especially being a border city, for lack of a better term, Spokane, down in the Tri-Cities, trying to talk to some of these people too, is what are you seeing?
Gary, do you have any information on that in regards to what happens if we make it into phase 2 and then a case happens? Do we drop back to phase 1, or what happens?
No, my understanding is that as long as we meet the criteria and we are approved to move to phase 2, then we are in phase 2 and there's no turning back at that point.
Not so.
Okay.
If you read the governor's, Gary, the memo that you sent out that had the full presentation of the governor's with all the multicolored slides on it, if you read to the very, very, very bottom of that message that you sent out, it said that the phase 2 can be rescinded. It's way down the fine print at the bottom.
Okay. Maybe I stand corrected, but my understanding is that once the entire state moves to phase 2 anyway, that I don't think they'll be moving anyone back at that point.
Yes, that's correct. But the individual state thing can be or individual county, excuse me, can be rescinded. It's way down the fine print at the bottom.
Laura, can you chime in on any of that?
Yes, it's my understanding is the same as Eileen's, so that on the individual counties, the governor's words or description of it was that it was a dial and it could be dialed up and dialed back down, depending on what happens from the perspective of public health statistics.
And do we have any guidelines on exactly what those would be? I mean, would it be one new case and we have to jump back, or is it somebody that goes into the hospital? I mean, I'd be really curious to know what that would be, or is it completely up to the governor's own choice?
So the guidelines to implement all of the phased recovery approach, those are coming out daily on finite topic by finite topic. So I have not seen one on what would happen to send a jurisdiction backwards, what that would require. But I'm confident they'll be developing that at some point and sending that out. They've come out with very specific guidelines on every other aspect of the reopening.
Eileen?
Thank you. We kind of got off track there a little bit. My thought was, to kind of, echo where Al's headed. This controversy and conversation about Pullman and Moscow and this and that has been going on for as long as I've been here, which is warming up on 50 years. And there are stores that I do go to over in Moscow, and I'm not going to mention any names right this minute, but having recently visited over in Moscow, I would encourage everyone to shop at home. Shop here in Pullman. The cleanliness, the friendliness, the just cannot be equaled across the border. And I know I'm going to take some heat for saying this, but as much as I love some of my stores over in Moscow, I'm sticking close to home. I think the local merchants and the local businesses have done an amazing job of taking care of us here in Pullman, and we should be rewarding them with our dollars.
That's true, Eileen, but we also have to be open for you to be able to go do that.
Absolutely. You're right, Al. But just wanted to give a shout out to how well our local people have done.
Okay. I'm going to move on to the next slide. Okay, so now we're talking about us specifically. So the general fund expenditures, we're looking, again, a lot of this is rehashed, but I'm going to dig a little deeper, but only ordinary necessary expenditures. So in paper, supplies, things we need to do to produce the work, out things like marketing materials, challenge coins, lending libraries within the department for leadership. We're cutting back all of that. We've talked about travel being suspended, and that's pretty obvious with the way the state is right now. We're going to continue doing the training that's mandatory and required to maintain the certifications everybody's worked so hard to get and keep, for either required or help us for insurance reasons or otherwise. Other departments identified cost saving measures. Everybody dug into their own department and said, here are the things that we can go without operationally, certainly on the short term. Every department head came and sharpened their pencil twice. So we had the original meetings right when this happened within a week, and we had them 2 weeks later and asked them to dig deeper. Curtailed operations like library, rec, transit. So we were out doing less. Something that just happened this week is we're postponing all the interfund transfers. So what I was mentioning to you, Councilmember Chapman, about paying these back and forth, we're holding off on anything that leaves the general fund. This happens twice a year, June and November. So we're just taking the June stuff, postponing it till November, and see how everything else goes. Any dollars coming into the general fund, like those utilities, we still expect those to happen. Overtime, we're keeping a hard line on that, managing that. We have a voluntary furlough plan that we are working on right now. We've had a lot of non-reps take advantage of this. We've had 2 of our bargaining units, ATU and Teamsters, sign their MOAs on this, and they're ready to participate and help the city maintain our position. And then we're also putting an emphasis on preventative maintenance to avoid any costly repairs. You know, we don't want to save a nickel on a whatever, so we're having a $10,000 repair later. So we're trying to work hard with the RD to make sure we're doing the right things. Okay, I hit everything. Any questions on this slide?
Mike,
Mike.
yeah.
Go ahead.
Go ahead, Al.
Go ahead, Brent.
Okay. Can I ask? So Chief Jenkins and Chief Heston, with the overtime, how are you managing that within your departments, not having overtime, or how's that working out?
This is Mike Heston Fire. Our overtime that incurred is for minimal staffing. So when we're at minimal staffing and somebody calls in sick, that's when we incur overtime for our stuff. We rearranged our training for our recruits, because some of that is after hours and on weekends. So Chief Lamro is doing a good job with that. But the overtime that we're doing is due to minimal staffing. So that's always going to be there. But we're doing our best to, with the last 2 firefighters that just came on board, that added some more debits to help pad some of that as well. So.
Yeah, this is Gary Jenkins for police. Some of ours is taking care of itself through a lot of canceled training that otherwise would have involved some overtime for the training itself, and also for backfill for officers that were gone at training. And then also some of it is just from the activity level with WSU not being in session and students not here. We don't have a lot of overtime where we used to have our swing shift hold over because of calls for service needed the additional staffing. And so that's reduced some overtime. And then in other cases, we're just trying to manage it with when officers are working cases and they're doing follow-up investigations on criminal cases where they would try to get those cases completed as quickly as possible. Now we are putting more emphasis on time management. And so instead of working some overtime to get a case done or to interview witnesses, they're waiting till their next shift to do that. And so our cases are not getting done as quickly, but we're saving on overtime. So those are some of the things that are happening.
Thank you. Al, you had a question?
Yeah, I want to go back to the bullet point there, talking about each department identified cost savings measures. It's super important to me that we involve our department heads and make sure that we know that any furloughs, any cost savings, and that kind of thing come from the department heads. They're the ones that know what's happening there, and I would hope that the decisions in regards to personnel and cutting things would come from the department heads versus administration. Is that what we're doing right now?
Absolutely. The department heads, each one to a person, have come both times with a plan in hand and, really scrutinized their budget and looked at their folks to the point where the library is down to 2.5 people right now. So we've asked for their participation, looked at their recommendations, had some very thoughtful discussions before moving forward.
And then in regards to the different departments, are we prioritizing in regards to maybe where we could cut a little bit more and others where maybe we wouldn't? I mean, public safety in my eyes, as Brandon was saying earlier, is extremely important, that we make sure that that area is looked at maybe a little bit differently than some of the other service-oriented things. And I'm not trying to pick on anybody here or any particular department. I'm just saying we are in a tough time right now. And this is why over the last couple of weeks, I've been voting no on an awful lot of expenditures, when maybe it could save somebody from being, furlough is just another word for being laid off. I mean, let's just be serious. That's what that kind of means. And that's what people are seeing. I'm going to lose my job or I'm going to be put off, when we could be maybe making sure that we're not spending money on things that we could put off for a while.
Sure. We look at each department, the essentiality of it, and then we look within the department as, okay, what operations are you performing right now that are essential within your department? So if we say we need to save, $4 million, and we say, okay, this department's untouchable. Well, okay, does that mean we wipe out everything else? When you look at the general fund and where the largest costs are and where the other costs are. So if we say we're going to divide the amount we need equally amongst the departments, certainly some of the bigger departments can absorb that. But if you get into something like planning, they have a smaller budget. So we're looking at what are the essential functions of the city, who are the people in those departments performing those essential functions, and we're working from the bottom up. So the most important things continue operating.
And in regards to who we are laying off, who makes that decision? Is it our administration in City Hall or is it the department heads?
We haven't got to that point yet. Right now, we're in the voluntary mode. And of the folks that have volunteered, why we're pushing it right now is the state is offering an extra $600 a week if they go on furlough or layoff, which is the next step below that. So we're looking at these things, is it best for our staff to hold on as long as we can? And, maybe we get there in the middle of June or late, middle of July, and this extra $600 a week goes away on July 25th. Are we doing a disservice to these people by not giving them the opportunity to voluntarily do this right now and accumulate these extra dollars? So we have a handful of folks that have gone for the straight furlough and they're just at home. And then we got another handful of group that we applied as a city to get into the shared work program. So the best example of that is the parks and facilities crew. And they brought this to us that what's the shared program about? And they got together and figured this out on their own and said, here's what we're going to do. Half of us are going to work in the morning. Half of us are going to work in the afternoon. We'll be furloughed for the rest of the time. So they're basically working part-time. That way the assets of the city are still being taken care of. Repairs are still getting done, but there's a cost savings to the city that way. So that was a really unique perspective to look at it right now. And that was a decision where they figured they could do it. We just asked for the operational plan. The department head approved it and the city administrator approved it.
So we haven't actually gone back to departments and said, you need to lay off this many people or this percentage or straight across anything. We haven't done that at all.
We haven't yet. We are, that's a step, that's a item that may have to come in a future time. If we can get to phase 2, then maybe we can figure out what the parameters are a little bit better, where the dollars are coming in. Right now, we're not in that. Everything has been voluntary. Like I mentioned, we've worked with, 2 of the bargaining units have signed on and said we are willing to look at this in a certain way as well, in case we can do that, because the ability to furlough versus layoff is we continue paying their benefits and they continue to keep their seniority in their bargaining unit. But when you get to a layoff point, and furloughs are able to be called back, where layoffs, it's you got to go out and apply for jobs, and that you don't get the benefits of the furlough with the layoff.
Okay, so that's all good. But here's the thing. We're talking with people's lives here. And I think that we have to be extremely careful with how we do this and making sure that the right people are making the right decisions. And I do have a quick question. Does the city council have anything to do with determining who gets furloughed and who doesn't? I mean, who makes the end decision on who gets furloughed from a department or not?
I believe, and Laura can jump in if I get this wrong, these are operational decisions that the department heads are working very carefully with administration towards, and looking to see what it takes to maintain, a budget that continues to bleed while providing the taxpayers the services that they need. Ann?
I want to say that as a member of the Finance Committee who has been reviewing the vouchers, I do see the reductions departmentally. And in conversation with Mike and with Karen Sires and Adam, I can tell you that these decisions are being made very carefully. The Finance Department is working very hard with the departments, both bargaining and in helping them with their expenses and their reductions. And it's all being done in a very deliberate and thoughtful way. And I'm included in some of that, just the information about it. And Dan is also. So I think we really need to trust our administration right now. This is what they are supposed to be doing, and they are doing it. And nothing is being taken lightly. People are not being dismissed or, as unnecessary. And I just want to assure everybody that these decisions are hard, but they're being tackled very deliberately. And I have confidence that we are doing everything we can to help people, but also watch out for the city's budget and making sure too that we are still providing services. And as you've heard from some of the presentations tonight, from parks and the airport, recreation, all departments are doing the best they can to continue to provide essential services. And that is the ultimate goal. So I just wanted to give kudos to as from sort of the inside, I'm seeing and hearing what's happening, and I want everybody to know that everyone is working very hard at this.
And I appreciate that. I asked the question because that is their job to help us get through this administratively. It's also our job to ask those questions. So really, I think that was it's incumbent upon us having authority over the budget to ask those kind of questions. And there's no question in my mind that they are working hard. They're doing absolutely everything that they can. And Mike is the right finance person to lead us in that. There's no question about that.
Absolutely. And I appreciate that. I just wanted to assure, because the conversation was sort of going into a different direction. And I wanted to just assure people that as a member of being a part of these conversations, that not everybody is, and knowing this information, I wanted to share that.
Yeah, and from my part, I've been here for just over a year, and I keep having these conversations with Jenna that, boy, what would this look like if we would have just got here now, if I were a new staffer, and, here's the lay of the land, and we're looking at essential employees, and we're asking for voluntary furloughs, and if it doesn't become voluntary, how does that change? And these people that have moved here, and they're the lowest on the totem pole, and I've spent a lot of nights staring at the ceiling, that if we have to make these decisions someday, just how gut-wrenching it is. So working with these bargaining units and getting a furlough policy agreed upon is just puts everybody in the best possible position before we have to go looking at other places. People matter, staff matters. It's we're a people business, and I want to get to a point where we can get everybody that has taken these voluntary furloughs, get them back to work. Once the economy's back, let's get back here. Let's open up rec. Let's open up the aquatic center. Let's open the library as soon as everybody feels safe and ready to come back to work. But we need that cash flow. and holding on to these expenses. And that's why I harp on these guys about the overtime, where we're talking about furloughing people and we're paying overtime out. It's that's one of those expenses that people look at. It's like, why are they getting overtime and I'm getting laid off, furloughed? So yeah, it's a very careful act, and we are working very hard with the department heads because there are operational things that we need to understand as well. So when something looks good on paper to me, I need to be able to translate that as to what it means inside the departments.
Okay, I'm jumping in here because had my hand up, just didn't get seen. So I wanted to, Mike, I wanted to let you know I really appreciate you continuing to emphasize furlough does not mean laid off. It means you're furloughed. It's a leave of absence. Don't need to cause any undue panic. And I think it's very important what you said, that everybody's doing the best they can. Everybody's concerned about this. Businesses, city employees, doesn't matter who you are. So I would like to say though, the training kind of concerns me. I'd like whoever we have on staff to be as highly trained as they can be. So I will just put that out there. I trust the judgment of each of the department heads and yourself, Mike. But I think it's really important to stay up with the training so that we're not playing catch up when things, start back up. So I'll just put that out there.
Sure. And it's not lost on us too. That's why when we looked at the training, the first thing is that all the trainings that for travel were canceled. So what were the other options going forward? And a lot of that's online. And I think that's great that we're adopting it, because that is certainly way more economical than what we were doing. So I hope we continue doing as much of that as humanly possible. The other part on that training too is we're looking at it as a postponement too. It's stabilizing the fund so we have these reserves going forward. So if things pop in the fourth quarter, like I'm optimistic about, yeah, we can open up some additional training as well. But for right now is what is necessary to keep these things up, and then we can continue doing other trainings to make us better at our own jobs as well.
And I think it's worth pointing out to residents that council really only has one training a year. We go to the AWC conference, and that's being done virtually this year. So, we're not doing our normal professional development either. We are doing it in a different way, and it's not costing us anything.
Okay. So thank you. This is all really good input, and I'm taking it to heart. I wrote a couple notes here as we were going on as well. So let's move into revenues. And yep, I did just turn the page. So again, my email from Friday, I alluded to the property tax collection, and I spent a lot of time choosing my words on that email of not disappointed. Now I'm deciding what that really means, but at this time last year, we had a 49.7% collection rate. Sure, because half the property taxes are due in April, half are due in October. So that's what we would expect to see. We've seen a little bit of curtailment on that, 45% on that, and this is one of our more solid revenue sources, reliable revenue sources. So when I look at property tax sliding off a little bit, it woke me up. I made a phone call up to the treasurer's office, and we talked about those dollars received in May that may be reported on the May item, but the treasurer's office worked real hard to book them in the month that they were actually paid, whether they received it or not. So they dated a lot of those on April 30th. So we can do a better job planning as a community here as to where these dollars are going. So I'm not expecting another push in May like we were hoping for. They really did us a good service on this. I certainly will continue to be in touch and see what other things lagged through. But when you're talking about a 45% collection rate and you extrapolate that out for the rest of the year, on this particular item. It caused me pause, and it made me rework some of the numbers, which you're going to see on the next page. Sales tax, again, the timing of the stay-at-home orders and the shutdown and the economy. So 2020 was really, Q1 was on par. Again, I mentioned in the previous deal, the March sales tax numbers at the end of this month will give us an idea, but the April sales tax numbers, I think, are the real canary in the mine shaft. Admissions tax, I don't know if we're going to collect any more admissions tax for the rest of the year due to the physical distancing changing everything. Is the movie theaters going to reopen? Is there going to be football? So this is kind of a funnel that I don't know what's going to look like at all, but I'm expecting no more dollars received. Obviously, charges for services have gone down since we don't have the programs and the curtailed activity. I alluded to this one a little bit in the previous discussion too on utility fees and taxes. You know, we had a kind of a mild spring and an early exit of the student population. A lot of buildings are closed, so they turned down their thermostats because we sure did as a city. So is that going to, run back down, or how's that going to look? We had some really nice collections in the first quarter, so we have some room to absorb some of this into the second quarter, but that's something we're going to monitor very carefully. So the next two bullets touch on what we talked, what Councilmember Chapman asked me about the buckets, where I was talking about the buckets and all of that. So I'm not going to belabor that point at this time, but I'm certainly happy to answer more questions on that. So that's the end of my notes on this slide. Are there any questions here?
Mike, you're going to get more admissions tax from the golf course.
Like to play some golf myself too. So thank you, Al. It's good to know. All right. All right. So let's get into the next slide on the financial picture as we see it. So again, the general fund is the greatest concern due to the volatility of the income streams. I just went over the admissions and the sales tax and even property taxes off a little bit. This is my reminder again that we started 1.65 million in the hole trying to balance this up. So my ever-changing economic position, and again, my disclaimer is on the next slide, so we'll get to that point. But my optimistic scenario is now up to a 10% hit to the general fund, $4 million. My pessimistic scenario rose slightly to 6.9. It all depends how fast folks are willing to come back and spend money in Pullman, keep getting things that if you're going to have it delivered and choose not to do business with the locals because you can't get to them and you still need something, please have it delivered here so we can get the destination sales tax. That'll help us a lot as well. But again, I'm still at one digit. As I mentioned last time, as soon as you start seeing more digits at the end and the numbers coming closer together, I'm feeling more and more confident about the projections, but we're tight in there. I like to belabor the point that we need some funding, unrestricted funding from the feds and particularly the state that put us under the stay home, stay safe policy so we can start handling some of these things so we don't have to furlough staff. And really kind of my question to council, and I would really like some guidance and some discussion on this, is what type of reserves are we looking to maintain going into the fall? We're looking at cold and flu season. Everybody talks about a possible relapse. I hear it called a resurgence, but since it's medical, I kind of call it a relapse. But we've been working with city administrator, the mayor, and trying to get an idea of where these things are. And we've been hung up on a 2-month reserve, which is about 16.7% reserves. We don't have an official reserve policy. It was something I was working on when I got here and was moved into other things. I know there's an unofficial policy of 13%. So I really, what is the council's comfort level? Because that helps me a lot in figuring out ways to close the gap. So again, I'm looking at a 2-month reserve, which is 16.7%. And please unmute yourself because I can't see everybody.
This is Pat.
In regards to your optimistic scenario and your pessimistic scenario, you're giving us a total deficit amount. How are you coming up with those numbers? I mean, is it that 10%, is that a lack of income or is it too much expense? Can you break that down a little bit? I mean, I know it's just some numbers there, but I need to know for myself, is it on the expenditure side or is it on the revenue side?
It's both. So what I'm starting with is that $1.65 million shortfall and saying, okay, we didn't have revenues to cover this. Now, what are our revenues looking like coming in, on my different scenarios, on my forecasts? What are the expenses trending at? Where are we able to cut? How does this move help us later in the year? So narrowing, okay, where's the revenue coming in? Where are the expenses at right now? And how do we bridge that gap?
So is that 1.65 million included in that 4 and 6.9, or is that additional?
No, it's included.
Okay. Thank you. Sorry, Pat.
No, that's okay. So I think I have a question and then I have a comment, Mike. My question is, when we talk about reserves, are we also talking about cash on hand?
Yeah, we're talking about how our cash on hand plays into the reserves and we can continue meeting our financial needs.
Okay, so what is a realistic number of days of cash on hand that we need to maintain?
That has an awful lot to do with how we're curbing the expenditures right now and looking at what, our biggest expense is salaries. Where do we go with that particular expense? Then we can look at things we can postpone and delay, like capital purchases. So how do we bring that down? So as we continue to fill the gap in between these things, some things become very important. Some things become, now we can wait on this. Some things can be, we can get rid of this item out of the budget entirely. So at the end of it, we get to a point where, all right, this is as deep as we can go before we actually have to start making some really tough, hard cuts. And it's going to be people first, just because it's our biggest expenditure. And, what do we want the city operations to look like when we get to that point? So when we look at days of cash, that's a tough one because we get such a big boost in first part of May when we get our April taxes, and another big boost in November when we get our October taxes. And then we're getting these little utility dollars are rolling in, sales tax dollars every month, but we expect a cut in that. Admissions tax every quarter, we expect a drop in that. So the cash flow is as much of a concern for me as it is how many days of operating expenses do we need?
Well, and I guess that basically gets down to my question about number of days cash on hand. So I guess you asked us what we're comfortable with. I would have to go turn that back and ask you 13% is awesome, but obviously it's not realistic right now for us to be able to do that. What is realistic from your standpoint of what you'd like to see for reserve?
I am very interested in answering that question, Pat, but if it's okay, I'd like to defer that in case other council members want to chime in before I kind of, poison the well with my answer. Is that okay?
Oh, yeah, that's okay. But again, as I said, you're the expert. I would defer to you because you have the best working knowledge of that. So.
Okay. Thank you. I will answer that question before we leave this slide.
Mike, if you could just give me one total here, what is you've given us a lot of slides tonight. What is our total expenditure and total revenue? We've millions and millions here and there. Give me some totals. Give me some numbers to play with.
For the general fund, I can do it as of the end of the quarter because that's what I have handy in front of me. I
want an annual purpose. What does our budget say?
I can do that. The general fund revenue budget was 23,349,491. So let's call it 23.35 million. Okay. The general fund expenditure budget was 24,869,352. So we'll call it 24.87 million.
Okay. Thank you.
Okay.
Mike?
Yes.
This is Dan. Looking at the previous slides talking about Q1 expenditures, Q1 revenues, I don't know if we're all getting kind of the sense of, you talked about how departments are curbing expenditures, but that's not really reflected in those Q1 numbers because a lot of that has happened through April. Can you kind of give us a sense of what is the overall impact that you're seeing for the April curbing of expenditures? Like, were we looking at before this, we would have had an April of, $3 million of general fund expenditures, and now we're looking at 2 million. Do you have any kind of sense like that right now, or do we have to wait more for some of those activities to kind of come through on the books?
Yeah, a lot of those, great question. A lot of those activities are coming through the books as we speak. I can give you a couple anecdotal notes, like as you've been working through the credit cards, we've been up in the, anywhere from $55,000 to $65,000 a month coming through credit cards for purchases, whether it's repair parts out of ERD or training, what have you. The credit cards for this most current period that we're getting ready to predict was $10,000. So we're seeing some of that. We look at the regular AP runs every week. And like last week was a $800,000 run, but 450,000 of it was interest payment to the Department of Ecology. So you back that out, you back out the rainy pool improvements of $144,000, which was a bond item. Those dollars are sitting in our account, and we're back into these, more manageable numbers where, yeah, there's a lot of effort going into the accounts payable coming through. The payroll part is starting to come through too, especially with some of the furloughs that have been happening. But up until this point, folks that haven't been working have been using vacation time and sick time. So we didn't really see a change in that part as we were trying to get this furlough part going out, because that is different than the layoffs. So exact numbers, I'll produce a report and get that out to council tomorrow with those. But anecdotally, I can tell you we are seeing the really pulling back of the reins.
Yeah, thank you for that. I just really wanted to make sure the rest of the council understands that, kind of those efforts towards expenditure curbing haven't really shown up yet. So what we're seeing here is based on kind of the old data, and we haven't quite gotten to those pages yet, in the financial book. So we have to kind of keep that in mind as the evolving picture comes into view, that we are going to see some changes in the expenditure side, but we kind of have to wait until we see that. And so what your question about what do we feel comfortable with the reserve, I think is a harder question to answer right now, because it's the situation evolves on a day-to-day basis. And so I think when we think about what do we need for a reserve is, what are some of the bare essentials that the city needs to do a bare operations? So there's certain items like our debt service that those items are just going to come out. Like there's not any modification of that we can do. There's some things that we can modify, some things we can't. So what are kind of in those two buckets of things we can modify and things we can't? What are our basic operating expenses that are just a matter of course that we can't move, we can't budge those numbers on, versus the things that are options, even if they are really hard options to or hard pills to swallow if we have to make some hard decisions. That's kind of where I come from with trying to figure out what reserve we should have.
And, maybe this wasn't a fair question to ask you guys at this point. Maybe this was a good time to get everybody thinking about it. Certainly, I'm going to weigh in as this is the floor. This is it, Mike. We can't go into the winter with less than this. Otherwise, then we're talking about massive shutdowns. So what is the minimum we need to run the absolute, we can quit talking about essential services at that point. We could talk about critical services. So I think that's what I'm driving at.
Sorry, Mike, Nate here, Nathan here. And I think Pat can kind of jump in here. I remember a ways back, I think it was 12 years, maybe it was 10 years, we were discussing, percentages. And I think at that time we were about 10 or 11, and then we were trying to raise it up to 16. And so, I mean, like Pat said, I trust your expertise above all else. But I just wanted to give a bit of a history, and I would love Pat to jump in here, or Mayor Johnson, regarding this, because I do recall when Barney, Councilman Waldrop was on council, he had been trying to get us up to, I think it was a 16%, but I'll kind of stay silent, and whoever else was on the council at the time can kind of give a bit of history, I think.
No, I would agree, Nathan. We struggled with that recession in 2008, and that is when our reserves dropped. And so it was thanks to Barney that we were able to institute an informal policy of the 13%. With Barney also making the recommendation after Walmart came online that we would take a certain percentage of the sales tax, because that was a big increase at the time, and put it toward the CIP. But, I will again reiterate what I said, and thank you for commenting on that, Nathan. I right now feel that it's up to the professionals to tell us what those load limits are. And whether that be best case, medium case, worst case scenarios, we need to be able to have some of the information. What are the implications of each one to get us to a point where we can make a reasonable decision?
I absolutely agree with
Mike. Go ahead. Sorry, Nathan. Mike, what is our reserve account right now? What's the dollar amount in our reserves?
Stand by.
And we also were using for 2020, because we're doing our first biannual budget, we were actually using some of our reserves to balance, as you recall too. And going back to what Nathan and Pat said, one thing with the council setting policy, it said in 2008 when we had the recession, we did not want to lay off city employees to actually add more to the recession. We wanted to try and keep those employees as best we could, which still is our goal here. And the other part was, obviously public safety is one of our major concerns of our residents, and that's one of our priorities. So,
yeah, I was just on the edge of that, Nathan, if you remember back in that time. So I remember all of this.
Yeah, and I was somewhere else when this happened, and I remember too. I had just gotten elected to city council in 2007. And then my third meeting in 2008, our finance director came to us and said, yeah, we need to cut 1.2 million out of the budget. And that that left an impression on me for a long, long time, and even as a finance director now. Al, the answer to your question is cash reserves as of last Friday was $4.5 million.
Thank you.
Mike, hey, so I know from the time I came on council, that was the informal policy is what I kept hearing, 13%. And, whether it's 13 or 16, I agree with council member Wright on, you would know what that load limit is, or could help give us some counsel on that. But are you working toward formalizing a policy? Is that what you're going to bring before us?
Well, not right now, because this is the term I use is, yeah, right now we're in the soup. we can strive for a high deal. I interviewed in other cities where I asked them what their reserve policy was, and one of them told me 35%, and I almost fell over. And I looked at our budget when I came here and saw using $1.6 million to bring the reserves to balance the budget would bring us down closer to like a 5 to 8% reserve at the end of 2020, with the budget that was already adopted. So it's very interesting here. This is a really good conversation. I'm stuck on a high, mid, and low right now, but I do want to prove this up to council. So I kind of have those answers right now. I know there's a couple of council members we haven't heard from, and I think Nathan wanted to add something, and I want to see if anybody else has something to weigh in on.
Oh, I had nothing more to add. Sorry. Yeah.
Okay.
Okay, well, I would love to just add one more thing. I think it would be wise to have a policy for consistency, and I realize that anytime there's a policy, sometimes there's rigidity added in there, right? And so we feel like maybe there's not as much flexibility. So we're weighing, trying to reconcile those two things. I also feel like it would be helpful to do the budget a little smarter from a council perspective, to have that. And that policy could go over scope. It could go over use and replenishment of that reserves when we do have to use it. And I just know in my role, I think that would be really helpful to have a written policy. And I think that's pretty standard in a lot of places. So maybe not right now. I mean, maybe we just need to get through this crisis, but for the future at some point, because we do trust you, I would like you to be the guy to help craft a policy that would be best suited for everybody.
Sure. And I mean, if a policy existed when I arrived here that said 35%, I would be back in front of council asking them, due to the emergency, we need to suspend the reserve policy and readjust that number, because this is what reserves should be used for. But knowing, not knowing exactly where we are with relapse and any other dollars that might be coming our way, I just assume that this is what's coming in. Okay.
Mike,
Yep.
on that, I just mentioned that I know this isn't this is probably a long ways off, but the news today did say that at least the House Democrats did have kind of their plan put out there. It's a very, very expensive plan, and it'll probably take some time before we get to the next phase of another package from the federal government. But at least showing a direction for what they're looking at is, and what a lot of talk in Washington seems to be is how the previous federal aid packages didn't include a lot of cash for local municipalities, and that seems to be a major part of what they're looking at there. So that's it's at the preliminary stages now, but at least that's the conversation going on in Washington.
And Dan, I might remind you that the conversation for the second loan was also talking about municipalities and counties, and that didn't happen. So who knows what happens on number 3? So.
Right.
Okay. Well, before I move on to the next slide, I'll just kind of give you my high, mid, and low. My high is a cop out. It's as much as humanly possible, squeezing and straining and getting everything else. My mid, and I think a conservative and measured approach, is certainly the 2-month reserve. That is a very standard policy you see across different municipalities. And I would say right now the low, if we were to like this, we want to do all these things that we don't want to cut anymore, Mike. This is as deep as we're going to go, but maintain. And I would say that's in the worst case scenario, that's 6 weeks of reserves. So that's going to be about 12%, where mid is about 16.7%. Okay. Thank you. This is a really good
Mike,
discussion.
our 13% that we've been playing with was just about your 2-month reserve.
Yeah, 16.7 is pretty close to that 13. Yeah.
I mean, if you're talking 24 million divided by 12, that's 2 million a month, right?
Mhm. And you know, if you look at like an 8-week reserve versus a 2-month reserve, it's, you know, there's days that slide here and there. So yeah, we're really very, very close. Okay. This is good. I'm going to work on proving this up, and I'm going to take a lot of this discussion to heart and work on a memo to kind of show you what we're looking at and what the different scenarios would look like. So I got some work to do for you all. Thank you for the input. It's been very, very, very helpful. So good news. This is my last slide, and I apologize. I usually throw the slide on there reminding everybody to wash their hands and buy local, and I'm going to keep doing that as well. So please wash your hands and buy local. So again, this is my disclaimer. Now that this is the information we have, more is going to come through, and think is dry, but the forecast will change. Somebody asked me earlier, you know, is this a moving target? Yeah, it's very much a moving target right now. We're trying to get a handle on this. We need more information. We need to start moving forward. So we're going to keep monitoring that. A lot of these you've seen before. One of the new ones I wanted to point out, though, it's too early to ask council to consider budget amendments. I don't want to be back and forth at this point. It doesn't do anybody any good. And every time we do a budget amendment, there is the work on the back end. I think we really got to get our handle around things, and we're going to wait closer towards the end of the year and see what it is. Keep briefing council. If I was worried about department heads overspending their budget in this emergency, then this would be a different story. But our department heads have, you know, they've suited up, they've come to play, they're doing fantastic. And then we're going to keep monitoring the, monitoring everything. And, you know, one of the other things that we're doing is maintaining our vigilance with respect to monetary and health and the relapse. And what we've done as a city, you know, I mentioned earlier about bringing somebody on the health to the back to work, but it's not just that, it's also the governor's orders. And then we've also reached out as a city and started working on survey. And I think it just went live today, but if council member records would like to kind of take an opportunity to move this, then I can take extra questions and wrap this up.
Sure. Do you want to take questions first and then I talk about that?
Yeah, absolutely. I guess let's. Is there any lagging questions or work product that I haven't mentioned that the council would like to see? Okay. Again, thank you for your guidance and your patience through this. We are working through this as a team. Councilmember Records.
Thank you, Mike. Yeah, today, you know, I worked on putting this survey together. Got a lot of good feedback from Jen Hackman, from the rest of council, and from some other partners. And with Jen's help and Darby's help, we were able to get this kind of launched today. It's on the City of Pullman website. So the easiest way to get to it is if you go to the main city website and scroll down to the news section, it's one of the first items there in that news and announcement section, and you can get into the poll. We're calling it the Reopen Pullman Community Poll, and really what the intention is with it is to gather feedback from residents of Pullman, but also people that visit and shop and work in Pullman, to gauge kind of what their comfort level is with different types of businesses reopening, what they might like to see or not see as businesses reopen in accordance with the governor's 4-phase plan for reopening, so that we can provide some feedback for city operations to kind of, you know, see what things we might want to implement as we reopen to do so safely, but also to give feedback to businesses so that they kind of have a knowledge base to work from, so they can make some decisions about their operations and how they're communicating with the community about how they're doing so safely. So I'd encourage everybody to take the survey, but also share it out. We want to get as many responses as we can. Since we went live starting at about noon today, I just checked and we've already got over 700 responses. So the response rate is really good, and it's going really well. And just kind of like monitoring a little bit today, there's a lot of really thoughtful responses going into this. So I look forward to working with Jen on the analysis, and then once we develop that analysis, we'll be able to provide out a report to our businesses and get we've been getting a lot of help from the Chamber of Commerce. So I want to thank Marie Dimkowski and also the President's Office. And I know that Adam's been in conversations with Paul Kimmel over at Avista and the Downtown Pullman Association as well. So thank you to our community partners for being a part of this and getting the word out. And the response rate is going really well.
Okay, Mike, nothing further. And Dan, thank you so much for that. And to have 700 already with just that few hours is fantastic. So
yeah, it's kind of a shock, but it's going really well.
Okay.
Thank you, Mayor.
With that, before we go our consent agenda tonight, I'm going to adjourn the City Council meeting temporarily as we convene the meeting of a special Metropolitan Park District meeting. First item is a motion to dispense the reading of the minutes for the Metropolitan Park District. Do I hear a motion to dispense the minutes?
So moved.
Second.
Moved and seconded. All those in favor signify by saying aye.
Aye.
Any opposed? With that, we now go to item number 2. It's a resolution approving the change of financial reporting for the Pullman Metropolitan Park District, the Washington State Auditor, from GAAP basis to cash basis. And once again, Mike Urban.
Thank you. I know the board has seen this presentation before as members of the City Council. I do have it queued up and I am ready to present it again. But if it pleases the board, I'd be happy to bypass the presentation because it is almost exactly the same and move right into questions and concerns and consider a vote.
Now, Mike, when you say almost exactly the same, what difference is there? Other than that, I think you can bypass.
Changed it from City of Pullman to Metropolitan Parks District and changed any references to the mayor to the director of the board. And I think I cut out one line about the process that I went through, and I added another line to the bottom of cities that have recently adopted this and added Pullman.
Thanks, I'm good.
All right. With that, do I hear a motion to approve this resolution?
So moved.
Second.
Second.
Okay, I'm going to make sure that we've got that. D, you've got that? Okay. All those in favor signify by saying aye.
Aye.
Any opposed?
Thank you, board.
We'll adjourn the meeting. The Metropolitan Park District will reconvene a meeting of the City Council. First item is the consent agenda. Do I hear a motion to read by title only?
So moved.
Second.
Moved and seconded. All those in favor signify by saying aye.
Aye.
Any opposed? With that, we go to Laura McAloon to read the consent agenda.
Thank you, Mayor. Your consent agenda consists of a motion to dispense with the reading of the minutes of the regular meeting of April 28, 2020, and approve them as submitted. A motion to dispense with the reading of the minutes of the regular meeting of May 5, 2020, and approve them as submitted. A motion to approve disbursements for accounts payable checks number 99883 through 99937, totaling $54,961.48, and a motion to approve disbursements for accounts payable electronic funds transfer numbered 4252020, totaling $60,131.86.
Is there any item the council would like on for discussion? Seeing none, the consent agenda consists of items 1 through 4. Do I hear a motion to approve?
So moved.
Second.
Moved and seconded. All those in favor signify by saying aye.
Aye.
Any opposed? We now move to our regular agenda. First item is a resolution authorizing the Mayor, Finance Administration Services Director to take all actions necessary to enter into a purchase and sale agreement with Justin Rogers for the sale of certain real estate property for the city to be developed for additional This is an item that we discussed last week. So Clayton Forsman is on the line. And Clayton, you might cover anything additional.
You bet. Thank you, Mayor, and good evening, City Council. As the Mayor mentioned, I already briefed everyone on this last week. The council packet has been revised a little bit to include the letter that came in last Tuesday from the College Hill Association. And also, I've included a photo of the site that I took last week just to help council visualize the property. And then lastly, Justin Rogers and his team, they prepared a response to the College Hill Association letter, and that has been uploaded for your consideration. I'd be glad to go over the basics of the sale agreement as I did last week, if that would be helpful. And of course, if there are any questions.
I just got a question.
Okay, Al, we'll go to you first. Al Sorensen.
I want to ask Laura a quick question here. There's been some concerns in regards to new input for this, and I just want to get a clarification in regards to whether we're still taking public testimony or not taking public testimony, or where this whole thing was at. Can you just clear that up for me a little bit?
That's a great question. This isn't an action that actually requires the taking of any testimony. This is simply the city entering into a purchase and sale agreement to sell property that the city has deemed surplus to its needs. So there isn't any requirement for any public input, but there's also no requirement that you not take public input. It's entirely at your discretion.
Thank you.
All I was going to do tonight, because we did have two requests, and that was only if there was new information that the council has not seen, would I take any. And again, it's not a public hearing. So that would be the only reason I would take any information tonight. Both Justin Rogers and Allison Montrolo requested time. And all I have to say is, if they're on the line, only if you have new information that the council has not seen. So if Justin's on, is there any new information that the council has not seen yet? And if Allison is on the line, any new information the council has not seen? With that,
Mayor, it wasn't unmuted when you were asking for Mr. Rogers.
Okay.
So Justin is not present, but Allison is here on the line. Allison, are you available?
Yes, I am.
Okay, great.
Okay. You heard the restriction, Allison. Only new information that we have not heard from you before or seen in your letter.
Yes, Mayor, thank you. I just thought I'd say hello since I have waited to speak and I didn't realize that. And I would just say that we would like the city to consider, if they do enter into this purchase and sale agreement, to compensate the College Hill neighborhood in some way for the loss of public green space, including
order
of the fund.
Okay.
Revenue that's generated.
Okay,
order.
that's fine. That's
You're muted, Glenn.
okay. With that, right now it's up to the council for discussion. Any questions you have of Clayton? Yes, Nathan.
Clayton, on that topic of green space, is there some exchange of green space on that? I thought we usually did do that with certain developments. Could you explain?
Sure. Really, Justin has indicated that he plans to keep this space open. As far as a requirement for green space, that's more of a planning requirement. I don't know that I could answer that fully right now. Just that he intends to develop the property.
Pete raised his hand there. Pete?
Yeah, so the requirement for open space is that it be at least 20% of the lot area for the type of development that Justin's interested in doing at that site.
Great, thank you both. So it sounds like Clayton is keeping it open as far as the green space. Justin, sorry, Justin.
Yeah, if you look at his correspondence, that's his intention to keep that space as open as he can. So,
okay,
so it sounds like sorry, Mayor Johnson.
That's right. That's right.
So it sounds like there really won't be that much loss of green space. I'm trying to follow it here. So
those details would be worked out at a future date. So it's all conceptual at this point, Nathan. We have the requirement from planning, and the purchase and sale agreement does not have any specific requirements for open space other than what planning would have, that Pete spoke to.
Thank you, Clayton. Pete, thank you, Mayor Johnson.
Ann, I saw first, and then we'll go to Dan. Ann?
Thank you. My clock is bonging in the background, sorry. I just had a comment. I think that one of the questions for College Hills Association was, how does the sale serve a public interest or benefit area residents? And I believe that Justin Rogers is a very responsible developer, and he has incorporated green space into his proposed plan, as well as he is working on a design that will fit in with the surrounding neighborhood. And I believe that that is a public benefit, because otherwise that land would just stay the way it is. And while it's okay the way it is, I do believe he would be making an improvement. There are sites around College Hill that, as the College Hill Association mentioned, can also be improved, as they did at the corner of Opal and Campus Streets. And I think that Justin, he is a native here. He lives here, and he really is interested, as shown by his other projects, both himself and in collaboration with other developers, that he does care about the integrity of the area. So I just wanted to comment on that. Thank you.
Dan Records.
Clayton, from what I recall in reviewing the materials and what our discussion last time that this came back up months ago, the subject property, are there city utilities running underneath it, so we're maintaining a utility easement?
You're remembering that correct, Dan. The purchase and sale agreement includes that contingency.
So does that mean that, there wouldn't be the ability to build any kind of structure on top of this, or kind of build anything that would block our access to those utilities? So I'm trying to think of, even if, Justin promised that these things are in development or in the plans for the development, it's not like there could be something that's going to completely take away the open space there because of that utility easement. Is that correct?
Yes and no. So a structure would not be allowed to be built over the existing utilities, but a developer could also propose to relocate the utilities at their cost. We would, of course, have to review that.
Okay, thank you.
Mm-hmm.
Are there any other questions of Clayton? If not, do I hear a motion on this resolution?
Move to adopt.
Second.
Moved and second. All those in favor signify by saying aye.
Aye.
Any opposed? Matter carries. We now move to item number 2. It's a resolution authorizing submittal of a certified local government grant application to the Washington State Department of Archaeology, Historic Preservation. Pete Dickinson.
Thank you, Mayor. Good evening, Council. Part of the city's responsibilities as a certified local government, or CLG, is to take inventory of historic properties in town. And each year we're offered the opportunity to seek federal grant money for purposes like this through the State Historic Preservation Office. Last year, the city's Historic Preservation Commission, or HPC, assembled a grant application for a survey of historic properties in an area on College Hill. It's bounded by Stadium Way, Lake Street, Colorado Street, and B Street. And Council, you approved the submittal of that application in April of last year. Unfortunately, the State Historic Preservation Office did not select Pullman's proposal last year, stating it would like to see more neighborhood support for the project. This year, the HPC decided to request funding for the same proposal as last year. The only change to the application is the addition of a letter of support from the College Hill Association. The total cost of the project would be approximately $18,400, most of which would go towards a professional consultant fee. And there is no financial match for the city, although staff would contribute a portion of its time to the effort. If approved, the work would take place between February and November of next year. The planning department would provide notification to all property owners in the study area before the project begins, and there would be a public presentation at the end to discuss the results of the survey. As I mentioned in my memo, it's important to note that the purpose of the project is merely to provide information. There are no property classification changes involved, and property owners are always in control of the historic designation of their individual property. So the action requested is to discuss this matter, and if you wish, take action on the resolution before you. That would authorize the submittal of this grant application to the state. The application is due by June 19, and I'll be happy to answer any questions.
Okay, Brandon, I see first, and then we'll go to others.
Pete, thank you, and thank you for reaching out to get, I guess, whatever support we needed to qualify for this in the eyes of the granting agency. So I read through this, and the one thing you mentioned, just staff time. I see 60 hours of staff time. Do you feel like you have 60 hours of staff time to give to this?
Well, yeah, it's a good question. The city is actually, to meet our obligations as a certified local government, we do need to put in time with the Historic Preservation Commission to do work on promotion, education, listing properties on the local register, accumulating historic records. And so if staff was not working on this particular project, it would be working with the HPC on other related projects having to do with historic preservation. Every year we have to report to the Department of Archaeology and Historic Preservation as to how we are meeting our obligations as a certified local government. And so, yeah, if we weren't working on this project, we'd be working on some other historic preservation work.
Thank you.
Eileen, did I see a hand up earlier on this?
I was going to move to adopt, but we weren't quite ready for that.
Okay. Any other questions on this? Then Eileen, the floor is yours.
Move to adopt R35-20.
I'll second that.
Moved in second. All those in favor signify by saying aye.
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 Any opposed?
Nay.
One nay. Okay. With that, we now move to new business. Any new business to come from the council tonight? The council only.
I do.
Okay, Al?
All right, I'd like to just talk a little bit here about some clarifications from last week's meeting, and want to just make a little bit of a statement here and talk a little bit for a minute. Just saying that you know, if the general public wants to get accurate information, I'm just going to tell you this: you should not rely on local newspapers, radio stations, or TV channels. You should watch council meetings live. And if you're unable to watch the city council meetings live, then you should watch them recorded and not assume things that were not said. You need to get the full context of discussions, not just short clips of conversations that the media puts together to garner reactions. That being said, for everyone that believes I said not to get tested for the virus, I did not say that. And if you feel that you're sick and you should, you know, feel like you might need it, Absolutely go test it. I never said not to go get tested. Please go watch the video from last week's city council meeting. Hear the entire discussion. It all had to do with Whitman County being able to move to phase 2 sooner than later. This was confirmed by Mayor Johnson on May 5th at our meeting, along with our emergency management manager, Chief Jenkins. The mayor tonight confirmed and said that, including Scott Adams, thinking that Whitman County should be moved to phase 2. And that being said, I'd like to make just a couple of quick comments here. I'd like to address the emails that I've received since last Tuesday. I again refer all people to go watch the video, get the full story, okay? And for the people who attacked my daughter for my city council position, those people are ignorant and uninformed. And if they have anything to say about my comments, they should contact me, not anyone else. For the others that have belittled me, because I know Mike Leach, which I've received multiple emails on. You don't know me or Mike Leach. And by the way, what does my relationship with a friend have to do with anything with my position on city council? Nothing. My friends are my friends. I do my job at the city of Pullman in the most nonpartisan way possible. Local government is nonpartisan. I do my job for the city residents. What is the best for the most amount of people in the city is how I do my job. I have always done that from when I was on the city council before, and now that I'm on the city council again. It has absolutely nothing to do with my political affiliation. And for anyone to think that COVID-19 has a political party, I don't think so. Okay? I will just tell you this to end this right now. I am proud to call Mike Leach my friend, and he is proud to call me his friend. And that's all I've got to say with anything from last week.
Okay, is there any, Dan?
Yeah, I just wanted to say something as well. You know, after last week's meeting, Al and I had a good phone conversation about kind of some of the stuff that was happening on social media. And I saw a couple of comments, and Al kind of referred to some of the emails that he was getting. And I just want to say to the residents of Pullman and to people that watch the city council meetings and follow local media, you know, resorting to making statements such as "I hope you get COVID and die" is just not appropriate in the public sphere. It's not appropriate for our community members to be having in discussions about civic topics. It's uncalled for, and I would appreciate if people would not make those types of statements. I think it's demeaning to the work that we do, and there are often times that we as council members need to talk about very serious issues that can become quite emotional for people, especially when we're talking about balancing kind of the issues and the concerns of public safety versus kind of the economic toll that this situation is having. Emotions can run high, but we need to be able to have these conversations in an open dialogue, and not have to fear for, you know, our safety or fear for harassment of our family members when we have to make some of these decisions that we have to make. So I just say to the community, you know, like Al said, look, if you're gonna have an opinion about these things, you know, make sure you get the full context. And I would encourage as well everybody to review the footage from last week's council meeting.
And when I was contacted by the news media or others, I said, you know, it's on YouTube. Why don't you take a look at what he said and also what Dan did as a response? So from that, is there any other new business? With that, the council now will be going into a closed session to discuss collective bargaining, which is not subject to the Open Public Meetings Act. At this time, do I hear a motion to adjourn?
So moved.
Do I hear a second?
Second.
All those in favor signify by saying aye.
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 Please, now, all council members, not others, but all council members, stay on the line. We will have